Hey everybody, it's Dr. Tom Moorcroft here, hanging out with my buddy Dr. Darin Ingels. We're going to get him added in here. Good to see you there. We see a couple people. I don't see you on there yet, Darin. There you go. All right. Perfect.
All right.
Thanks everybody for joining us for, Lyme Disease Awareness Month. It's coming to an end, but Darin and I wanted to have a conversation. Lots of questions have been coming up over the course of the month, and we just wanted an opportunity to sort of be here to answer any questions you have. So, Darin, how's it going, man?
Oh, good. Sorry, I'm just trying to get my Instagram situation here, and I think now we're good to go. Awesome.
All right. Sounds
perfect.
Good to me.
Good. Well, I know we've both been getting a lot of questions with Lyme Awareness Month that we want to help answer for everybody. And we've got a lot of different topics we want to cover. So I think the first thing that we probably want to cover, because I know we both got a lot of questions on our Instagram and Facebook pages, is about biofilm.
Oh yeah, and I'm getting a little extra here, so I'm going to just change the volume just a smidge so that I can hear everything just right. So just bear with me 1 second. I think we're in good shape, though.
I think we're in good shape now. Yeah, I don't hear the echo.
All right, we're good. Perfect. All right. So I hope everybody can hear us here. If you can't, let us know. We're always trying to do multiple tech things and reach out to everybody on whatever platform so that we can do this. But yeah, so what's your take on biofilms and Lyme and other things, and what questions have been coming up on your sites?
Well, I think some of the biggest questions that we've run across with biofilm is, what's really the best way to approach it? Because people are doing so many different things, and then we hear a lot about these negative reactions and like Herxheimer reactions when people start busting up the biofilm. So I think it'd be really great if we could kind of talk through, what's the best way to treat biofilm, and if people start to have negative reactions, how can we walk people through that? Because I think it's important that people take something to break up the biofilm, but we don't want to be so aggressive with it that it starts to have a negative impact, and then people just feel, worse after the fact. So do you want to talk a little bit about your approach to it, and then I'll chime in with mine?
Yeah, I mean, it's cool to me because, I mean, I always try to explain to people, what we know about biofilm and what we don't know. And, it's essentially like a whole bunch of organisms getting together to kind of hang out and protect themselves. And one of the primary components of a biofilm is fat, which is protective, as well as a bunch of other substances. And one of the things that I've read is different biofilms, can require anywhere from 200 to over 500 times the normal antibiotic dose to penetrate it. So if we're going to be doing something like, say doxycycline as an antibiotic treatment, you can't take 200 or 500 pills twice a day. It's just not possible. So that's why we have to do these kind of other things, right? And so one of the things I do is I use a fair amount of liposomal artemisinin, which is basically fat-bound artemisia. Some people know it as sweet Annie. And, it's an antibabesia, anti-malarial herb, but in here we try to put it in with some fat, phospholipids, and EDTA, kind of to make a Trojan horse and help break it down.
Right.
Some of the other things that, I look at using could be systemic enzymes. People use nattokinase, serrapeptidase, and lumbrokinase, and we feel that might be helpful. Certainly, we had a conversation the other day talking about potential use of things like monolaurin. Because monolaurin has been shown to work, and at least, the problem with any of these things, Darin, is that we're talking about a petri dish study. I mean, there's nothing really done in a mammal, so we don't really know. But the bottom line is monolaurin helps with candida, it helps with Yersinia, it helps with Borrelia, at least in petri dishes. I do use a fair amount of biocidin also because, in its liposomal form, because it's been shown to go after that. There are certainly some others, but what are the ones that you're finding, and what are you using?
So you mentioned earlier the lumbrokinase. I actually like it a lot. Lumbrokinase, if you look at most of the research, it's actually on cardiovascular disease. So, the implication's a little bit different, but when you look at it compared to nattokinase, the research shows it's 10 to 12 times more potent than nattokinase. So based on what it does as a fibrinolytic agent or its ability to break down clots in the body, we can sort of extrapolate that it probably does the same thing for biofilm. So I think it's really effective, but I think the downside is that it's expensive.
Super.
So, a bottle of lumbrokinase can run $100 to $120 depending on the manufacturer. So it can be cost prohibitive for people. So, where cost is an issue, which for most Lyme patients is, I think serapeptase is a better option just because, there are products that mix serapeptase with EDTA. Again, they're very effective at breaking down biofilm, and I think it's reasonably priced. I also like NAC, N-acetylcysteine, which is an amino acid. NAC is a precursor to glutathione, but you also get the biofilm breaking effect. People need to be aware that if you're going to use NAC to break down biofilm, long-term use will actually deplete zinc. So you do need to make sure that you're supplementing with zinc if you've been taking NAC probably longer than maybe a couple of months or so. Lactoferrin I've used minimally. Again, I think it's really good at breaking down biofilm, but because it's from a dairy source, and so many people do have a dairy allergy or sensitivity, that tends to be a bit problematic. So if you've got a dairy issue, you're probably not going to want to use lactoferrin, but if you do tolerate dairy, it can be pretty effective at breaking down biofilm. The other one I know that I get a question a lot, I personally don't use a lot of it for a lot of reasons, but people are talking about stevia.
Right.
On, Dr. Shafi's work for breaking down biofilm. What do you think about stevia?
Well, I mean, I think same thing. I mean, I've seen the studies on it, and again, it's just a small study. I try it sometimes. I haven't really seen like some spectacular, benefits to it at the moment. Again, it's one of these things that it's been used as an antimicrobial for an extremely long period of time through human history.
Right.
I don't think there's any massive downsides to it, but at the same time, I don't know that I'm like, wow, it's the best biofilm buster ever.
Right.
But I would like it to be for sure. But
yeah, my concern with stevia is that it is a sugar, and most carbohydrates are metabolized in the very first part of your small intestine. So the likelihood of a lot of that stevia getting to the target tissue that contains the Lyme is probably pretty small. And I find some people really like to go heavy duty on the stevia, and they start getting all these gastrointestinal problems. So you want to get a lot of gas and bloating and these kind of issues. And if you've already got SIBO and you start adding stevia to the mix, there's a pretty good chance it's probably going to exacerbate the condition. So stevia for me is really not my first choice. Again, I think something like serapeptase with EDTA or lumbrokinase is probably a reasonable place for most people to start. And you don't have to take all biofilm busters at the same time. I mean, you can pick your one or two and stick with that first and see how you feel.
Yeah, no, I agree, and I think it's one of the things I see all the time is that people are like thinking like, hey, some is good, let's do a ton more, and whatever biofilm buster I'm using, and I think that this most of the time applies to anything I'm doing. I mean, just add a little bit and work with it. Certain antibiotics and certain have to get to a certain dose for it to work. And certainly in an acute setting, if somebody comes in with, say, a Bell's palsy with a facial droop that's brand new or a heart block, I'm probably gonna just reach for my antibiotics to start. But outside of sort of the acute setting, most of our patients with chronic illness or sort of this slow, insidious onset, we need to just work our way into it. And a lot of times I find that people are going too fast, too hard, and we're putting like 3 biofilm busters and 5 different herbal tinctures going after Lyme and 4 for Bartonella, and it's hard way to mix it all up.
Yeah, and I think the other thing that happens a lot when people start their biofilm busters is they do get like a die-off reaction, like a Herxheimer reaction. So maybe this segues nicely into how do you manage that when people start to take their biofilm protocol and they get worse?
Right. So I was just changing my earpieces there. So what was the last part of that there?
So when people start their biofilm protocol and they start to feel worse, how do you manage it?
Yeah, that's a big one. I think that the starting point for me is I start ahead of time. It's kind of like anything else. I want to prevent somebody from getting a tick bite. I also want to let them know that biofilm die-off is a possibility and it's a real deal. Right. So start slow, start low and go slow. Other things is I prep people, I mean, sometimes like a real Herxheimer is only going to be lasting a couple of days. Now there are different variations and you hear stories of these super long things. Right. But they're probably different kind of reactions, So for the true Herxheimer, I certainly, one, knowledge is power. Knowing it's going to happen is potentially a good thing. Detoxification, you're talking about like N-acetylcysteine as a potential glutathione precursor. Glutathione I use a fair amount of, to just sort of acutely help. A lot of times in the acute sort of Herxheimer reaction, I'll have people taking 1,500 to 2,000 milligrams of liposomal glutathione along with maybe some lemon lime water, and then also, something like an Alka-Seltzer Gold or Pico, which is kind of like a different version you can get over at Walgreens and stuff, just to alkalinize and help detoxify. Certainly berber and parsley I found have been really good to be, to use, both in acute settings and chronic settings. And so, I just kind of, part of it is don't go too fast. And the other part is, that we didn't really touch on yet is the other parts of detox that you build into your protocols. So, and I don't usually just like drop bombs on people. My feeling is, why don't we get going and start off with something simple, like let's get some, rebuild the gut. First of all, let's find out what the diagnosis is, then rebuild, do the gut, do the detox and the whole 9 yards. So we're kind of coming at it from the other side. So I know we're planning on backtracking to address some of those other things I brought up. But yeah, I think the basic detox pieces are just to get started with the basics of detox, and then also not dropping a nuclear bomb on day 1 or 2.
Right.
Any tricks that you have, Darin?
Yeah, it's funny you mention that, because I look at like Dr. Cowden's protocol, and if you follow his protocol as it's laid out, the first 2 or 3 months are really just dedicated to detox. You don't even really start getting into going after the organism until, he feels like, you've fully, opened up all your detox pathways so your body has the capacity to, deal with the active treatment. So I think anything we can do, and we can probably talk a little bit more later about some of our favorite detox strategies. But, when the Herxheimer reactions come on, I've used a lot of trisalts, which, as you mentioned, is an alkalizing agent. So it's a combination of sodium, potassium, and calcium bicarbonate, and they make it as a powder form or capsule form. The other version of this that you can find out there in the pharmacies is Alka-Seltzer Gold. It's very similar in many ways, but we know that when you alkalize the body, if you look at the research, it actually helps reduce inflammation, actually promotes cellular repair as well. So this has been used in environmental medicine for 60, 70 years as a way of mitigating allergies, allergic reactions, inflammation. I've had kids in the middle of an asthma attack that can stop it by just taking trisalts or baking soda. So this is a really cheap, inexpensive way to help mitigate a lot of these Herxheimer reactions. And so, my patients will usually carry their trisalts or Alka-Seltzer Gold with them when they go out in public. Again, if they start to herx when they're at work or just out and about in their day, it's really nice to have that on hand to help mitigate their reaction. So that's one of my favorite ways. And you mentioned the berber panella from Dr. Cowden Nutrimetics. I find that people can take 5 drops every hour and a little glass of water, and usually after a matter of hours, their herx reaction starts to mitigate.
Oh my God, it's Darin. Sorry to interject, but it's funny. When I was training, I was told you can do berber for 10 drops every 10 minutes times 8, and if that doesn't work, do 10 drops of parsley every 10 minutes for 8. And then if it doesn't calm down after a bottle of each of those, you're pretty much screwed. But it's like,
well, you mentioned earlier, and I think it's a good point. It's like, how long is a Herxheimer reaction supposed to last? And I've had patients come in, I'm sure you have too, they come and said, gosh, I've been herxing for 3 months. I'm like, well, that's not a herx anymore. That's you having a negative reaction to whatever treatment protocol you're on, and you probably need to revamp it a little bit. Yeah, a true herx reaction is usually a matter of days, and I've seen it maybe up, 10 days, 2 weeks, but it doesn't usually last longer than that. If it's going on 3, 4, 5 weeks, there's probably a pretty good chance that whatever you're taking is just having an adverse reaction with you, and you need to change up your protocol a little bit.
Right. Yeah. Yeah, absolutely. And I think the other thing is, think about when the onset is. I know, like, I have some people who take something and within like 5 or 10 minutes, they're taking something and they're like, oh my God, like I'm having this massive Herxheimer reaction. And at that point, it's not really even digested.
Yeah.
In most cases. And I see people, with mast cell activation syndrome, that can start to be triggered really quickly. There's also sort of the component of expecting the Herxheimer. and stuff that comes out. So there's so many things that we have on I know we have a list of questions that everybody's thrown at us and we really wanted to talk about. But I'm thinking maybe I love the biofilm topic, and maybe what we could do is circle around to the front end of this whole kind of conversation about where we get started. That way we can kind of go in a little step-by-step order, I hope.
Sure.
I don't know. Because like, I feel like the way my brain thinks, I'm like going backwards along that track and which is good, but maybe we can fill in some people. And Diane had actually posted a question about, she had 2 negative Lyme tests so far, but she had a rash on all the symptoms. And so a bunch of doctors said, you don't have it. Now it's a year or so later. What am I supposed to do? Where do I go from here?
Yeah, well, I think, the end of the day, everyone needs to realize Lyme is a clinical diagnosis. I mean, even to go to the CDC's website, it says it right there. And it's still shocking to me that after, 40 plus years of research on Lyme, that we still are in this daze that, we rely so much on the test as a factor of you do or do not have Lyme. Lyme is based on your clinical symptoms. And again, I was a microbiologist before I was a doctor. I actually used to do Lyme testing for a living. And, it's funny because this test was never designed to be diagnostic. It was actually designed as a surveillance tool to monitor the people that had known Lyme disease. For the people who had the classic bullseye rash and headache and fever and so forth, they wanted a way to monitor these folks to make sure that, their treatment was working, not really knowing at the time that antibodies, unfortunately, are not a reliable way to monitor treatment. But, that's kind of what happened. So, you've got to look at your clinical symptoms. So I think Lyme diagnosis is a combination of, do you have the symptoms? Dr. Horowitz has a questionnaire that's been validated. I have a questionnaire in my book that's kind of a shortened version of his.
Right.
These questionnaires are available to kind of give you a pretty good idea about your exposure. We do the testing anyway to kind of give us idea about whether you've had that exposure. And then you kind of have to rule out a bunch of other stuff. Right. So Lyme's called the great mimic, the great imitator. It looks like a lot of other conditions. So part of us on our doctor side is that we're trying to rule out other possibilities that might explain your symptoms.
Right. And I think it's important to understand, like I went back in my residency training and I said, what does the science actually tell us about this whole thing? And one of the things that it tells us is that, if our pretest probability of having Lyme disease is greater than 80%, meaning we really think you have it, if we do the test, we have a much greater likelihood of having a false negative. So basically, if you're looking at your typical doctor's office, we need to look at this and say, hey, you live in a Lyme endemic area, you've got stuff going on like a rash that's consistent with an erythema migrans. So you've got Lyme disease, especially now that I have symptoms on top of that. So, I don't need to go and look for some other diagnosis and I can use my testing to say, find out for sure, or if I want to follow you. But to me, at that point, you've got Lyme disease if you have the rash and symptoms. But the other part of what you have to think about if you do testing is, do you have a co-infection? Right. And the other part about testing, just to kind of throw it out there, is when you have the rash, it's very early. And the likelihood of you actually developing antibodies to Lyme at that point is low. Right. You need 3, 4, 6 weeks in some cases to start doing that. So in an acute setting like that, something like a DNA test might be more valuable. And a lot of times if I see somebody very early on, which I'm super happy I do, because then we have a chance, right?
Yeah, it hardly ever happens, but
yeah, at least not in our practices. I know it does in somebody's, and so hopefully they're going to start doing this and preventing chronic Lyme. But the point of it is, we just need to go. We need to go through it and make a diagnosis, order the testing if it's appropriate. If it's too early, you're going to order a test and you're going to be finding out what happened to this person earlier in their life, which is really helpful. But it may not, but it drives me nuts. They come in with an erythema migrans rash and joint pain. You diagnose them with Lyme, you do the testing and it's negative 3 days later and you say, stop your treatment. I'm like,
right.
It's too early in the disease.
Yeah, I swear, I think a lot of doctors skipped immunology in medical school and they forget how this whole process works once you get exposed to an organism in terms of, the incubation period, the time you get exposed to an organism from the time you elicit an immune response. And we know with Lyme from the research, again, it can take, 4 to 6 weeks before you really start making antibodies. Although clinically, you can start getting symptoms sooner. So we certainly wouldn't want to delay treatment for someone who's suspected of having acute Lyme disease. And I get this all the time where, in fact, I got 3 emails over the weekend of people who pulled ticks off their body, that was embedded. And now what do I do?
Right.
Do you treat? Do you wait? I think that becomes pretty confusing for people. And the old CDC recommendation of 1 dose of 200 milligrams of doxycycline, which has no scientific basis whatsoever, has never been shown to be helpful. It's just it becomes a problem because people are getting under treatment, when they have suspected exposure.
Well, and one of the things that was really interesting, because I was on, the panel where we reviewed the ILADS guidelines, where they really broke down and evaluated that study in a very open manner. The thing that we found was they said it was like 87% effective in preventing a rash. But the problem is a rash does not equal Lyme disease, right? And so the CDC says at least 30% of people who get Lyme don't have a rash. In the research, when you look at it, it's like 40 to 60%. So call it 50-50 whether you're going to get a rash or not. And in my experience, it's lower than that. The other problem with the rash, a lot of people don't even know what the rash is. They're looking for a bullseye. A bullseye is 20% of all erythema migrans Lyme rashes. Right. So that's a big problem. So, but what was interesting is, in that study, if we assume that a rash is a good surrogate for Lyme, which it completely is not, but if it were, the problem is they had people in the study who developed Lyme disease and their blood tests remain negative. So, and the other problem, so we're blocking the ability of the body to make an antibody, and we might be preventing a rash. So now 2 of the most commonly utilized diagnostic indicators in a primary care setting, pediatrician, internal medicine, family medicine, rash, and the positive test have now been prevented by taking the Lyme prevention. The only problem is we've prevented all the indicators, but we've not prevented the disease.
Right. Yeah, that's not
what do you do?
Well, and I think that's why, doctors like you and I have a different approach, thank goodness, because it's not so short-sighted. And, we rely more on, we treat people, we don't treat pieces of paper. The piece of paper is really nice to help confirm our suspicion. And, again, as a former med tech who used to do these tests, I hear this a lot. Well, I had a Lyme test. My test came back positive, but I took it to my doctor and they said, no, I actually don't have Lyme disease. It's a false positive. And I can tell you from experience that false positives are rare, extraordinarily rare. False negatives are extremely common, but when you've got a false positive, when you've got a positive test, especially if you've gone to a regular conventional reference lab like Quest or LabCorp, because they're notoriously negative when someone actually does have Lyme. So when you get a positive with them, you're pretty darn sure you've had exposure.
Right. And so, when you look at the meta-analysis, right? So that's what we call it when we take a whole, when researchers evaluate critically several articles in the medical literature, looking at everything, looking at a particular topic. In this case, what they call the 2-tier testing strategy, right? So a screening evaluation followed by a Western blot to confirm it if it's positive or borderline. And what they found was that across the board, if you're positive, it's like 99 to 100% you're positive.
Yep.
Right. But if you're negative, we might miss 44% of people who are truly positive.
Yeah.
So it's like, it's not a problem with the test being good if it's positive. It's a problem of what does it mean if it's negative. And so that's really the problem. And testing is difficult. There's a whole bunch of different strategies to do. And I think that what people really should understand is that it is exactly what Darin was saying. It's a clinical diagnosis supported by laboratory data, and we really need to, that's where we need to go with it. You need to know the clinical diagnosis. And when you're talking about the questionnaires, I didn't want to forget to mention something. In Dr. Horowitz's questionnaire, one of the most important things to consider is migratory joint pain. right?
Right.
I mean, what other disease process do you know has pain that moves from one area to another, then to another, and then back to somewhere, then to a different place, and now over here, you know? And so migratory joint pain is critical to think about.
Yeah, and I'm glad you mentioned that, because I've actually had this discussion with a lot of other practitioners that will argue with me. It's like, no, 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 there's a whole bunch of other things that cause migratory joint pain. I'm like, name one.
Name one.
Name one, because I can't think of it. It's not Reiter syndrome. It's not rheumatoid arthritis. It's not lupus.
Not the flu.
I mean, all these classic, autoimmune diseases we associate with arthritis, I'm not aware of any. And I've heard Dr. Horowitz speak more than once and say this, that it's true. I mean, I can't find anything that causes migratory joint pain.
Right.
Typically, if you've got other conditions that affect the joints, it tends to be the same joints. It's consistent. It's bilateral, like often in rheumatoid arthritis. So when you hear about it's my right shoulder, it's my left knee, it's my right ankle, and it changes day to day to day, again, I'm not aware of anything else other than Lyme that causes that.
Right, right. And I mean, I think the thing is, I have like some right knee pain and some right shoulder pain from time to time, but I did a lot of sports and I busted them up, but it doesn't change and it's always consistent. And it's not like I have, the one shoulder, then the hip, and then the other knee, and then the other ankle, and then the other hip that wasn't the first hip, that kind of thing. So that's important. One of the things you brought up, Darin, was what the heck do you do? I mean, I got this call a couple times this week already. It sounds like you got 3 over the weekend. What are you recommending to people in place of maybe this 200 milligrams of doxycycline if they got bitten by a tick? Or what's your thought process? Do you recommend prophylactic preventive treatment, or take us through that?
Yeah. So for me, I tell people if they find a tick, and particularly if the tick is embedded. Now, look, if you found a tick and it's literally just walking across your skin and there's no evidence that it's bit you, just pull the tick off and dispose it, and it's fine. If it's walking across you, it hasn't attached to you, it hasn't had a blood meal, it hasn't shared anything yet, so you're pretty safe. Ticks don't typically feed off you, have a blood meal, and then cruise around your body. Once they're done, they tend to detach themselves and they fall off. So a walking around tick's probably okay. But if it's embedded in you, you definitely want to get some tweezers. You want to grab it by its head, lift it straight up gently. Don't yank it out. Don't dump gasoline on it. Don't light a cigarette or a match and try and burn it out. All these other old wives' tales are more likely to cause harm than good. So just get some fine tweezers. And if you don't have any and you live in a Lyme endemic area, please go buy some. And they actually make these cool ones that have a little magnifying glass at the end so you can actually see the tick.
Dude, they're so helpful.
Yeah, because I mean, these ticks, a nymph is the size of a pinhead. It's really, really tiny and hard to see. I can remember living in Connecticut. I had a tick on me, and I thought it was a fleck of dirt, and I kept flicking it, and then it started moving. I'm like, okay, that's not dirt. Dirt doesn't walk. So, they can be really hard to see, but those tweezers can be really helpful in just, dislodging the tick. And if you can keep it, put it in just a Ziploc baggie, put like a damp cotton ball in there. And I like to save it so you can send the tick off and be tested.
Right.
And there's a lot of great labs that do tick testing. They can test for, Lyme and all the co-infections for a pretty reasonable price. And although it's not perfect, no testing is, it at least will give you an idea about whether that tick may be carrying Lyme, and that might help guide your treatment moving forward. But if I know it's a deer tick, my feeling is I'd rather start treatment right away until proven otherwise, just because we know that early treatment is less likely to lead to any kind of chronic problems. And for me, now having been in the game now for about 20 years, I actually use herbs. I find herbs are very effective, but I have the discussion with my patients, and that if they want to use antibiotics, I think that's a very appropriate use in early Lyme. You've got a good chance of, getting rid of it before it ever becomes chronic. So I think for me, I have that discussion about antibiotics and herbs. We talk about it. We decide together what we think is in the best interest. But as a naturopath and trained herbalist, I have a lot of faith in herbs. I've used them very successfully for a long time, and I think they work as well as antibiotics without causing some of the gut disruption. But again, it's really, I think, personal preference.
Yeah, I mean, I think I'm in the same boat. I use antibiotics. I use herbs. I'd probably use more antibiotics in that situation than maybe you would, just based on where my training is and stuff. Yeah. I mean, but, the thing you have to understand, just from like, what's the duration of treatment? And some people have been asking in the comments, like, what's the duration of treatment in general? What do I do with different tests? And we're going to roll into that. But for preventive treatment, we don't know, right? I mean, the studies that are out there are not all that good. What we do know is that if you take a mouse and you inject it with Lyme disease, or you inject it with Lyme and anaplasmosis, if we give them a 19-day long-acting doxycycline shot, it works 100%. So most of us are kind of talking about, if you're going to do a treatment, do it at least 3 weeks, if not 4 to 6 weeks. I mean, is that kind of the ballpark you're starting at?
Yeah, for me, it's usually 6 weeks. I think, understand that Lyme is a very slow replicating organism. Most bacteria in your body replicate every 10 to 20 minutes. And Lyme, if you look at the research, is every 1 to 16 days. So that's extraordinarily slow. And consider that like an antibiotic like doxycycline, it actually doesn't kill the bug. It stops the bug from replicating.
Right.
It's a bacteriostatic antibiotic, not a bactericidal. So, 10 days of antibiotics, if you follow the CDC's recommendation and they give you 10 days of doxycycline and the organism replicates every 16 days, you literally haven't even gone through one life cycle of the organism to have a chance to actually kill it. So that's why, we always recommend these longer courses of treatment. And our prototype is tuberculosis. If you ever get TB, you're going to be on antibiotics, 3 of them for 6 months to a year. And the reason you're on
at least, right.
Right. And the reason you're on so long is because it's just such a slow growing organism. Well, Lyme's not that slow, but it is relatively slow.
Close.
So yeah, exactly. So, we've got to use these longer courses of treatment. And again, I think most of us feel like we can do things to help protect your gut, protect your mitochondria, protect your other parts that might be affected by the initial treatment versus what would happen if it developed into persistent Lyme. And now you're into a whole different, ball of wax.
Right. And I think a couple things that, like, as you were talking through the last couple of things that I really think are key for people to understand is, one is you said you sit down and talk to the patient, right? Which is just like, this is an amazing thing in medicine these days. It's like you find out, do they prefer herbs? Do they prefer meds? What is their medical, model? The other thing is with doxycycline being bactericidal, static, I should say, a lot of what you and I are doing is actually helping a person's immune system kind of reboot and lift up your immune system, because your body's doing most of it. I've never asked any doctor who works in a critical care unit or pulmonology if our antibiotics, no matter how strong they are, if they kill all of the pneumonia. Pretty much everybody says what ends up happening is your body, we just keep you in a good place and keep the level of the bacteria down until your body can take care of it. And that's so critical in everything else. And it's no different in Lyme disease. And I mean, I think the other part too is, after the tick is fed, it's not going much anywhere. And if anybody wants to look on Facebook, Instagram, you can take a look at, like, I posted some videos my daughter took of an engorged tick. I mean, it's on its back going, woo, it's kind of gross, but it's out there, to see. And it's important to understand that in Lyme disease, at least with the deer tick, the Ixodes tick in North America and on the most of the country is the deer tick. There's little changes on the West Coast with the Western black-legged tick and such. But the bottom line is 95% of the Lyme is being transmitted by a nymph, right? And the nymph is the size of a poppy seed. Right? So go grab a bagel and look at the little black dot. Now drop one of those, on the table and go find it, right? I mean, it's small. So that's why a lot of people are getting them and not seeing the tick bite. So.
Right. And remember too, that the ticks like to go to the areas of the body that often you don't see. It likes those warm, moist areas of the body. So it likes your groin, behind your knee. I got bit behind my butt cheek. So I didn't see, I had a big bullseye rash, but I couldn't see it because it was behind me.
Oh no.
It was in your ears, your hairline. I mean, I've seen these rashes, for those who do get it, pop up in really bizarre places, but often they're in places that people don't generally look. So particularly for, I think, parents, with your kids when they're out playing outdoors, if you live in a Lyme endemic area, I mean, I tell parents, strip your kids down head to toe and look in all the cracks and crevices, and they may not like it, but again, it just increases your likelihood of picking up a tick if there's one that might be attached.
Yeah, absolutely. And one of the things that I got interviewed by Men's Health a while back, and they said, how do you keep ticks off your privates, basically, And I said, well, one of the things that I have people do is wear sort of, like compression shorts and boxers that are kind of like not so sporty, super compression, but they're kind of skin tight, and a skin tight shirt that's like of that material actually can help keep them out of your armpits and your groin. So the thing people also have to realize, though, is Lyme is considered paradomestic, right? Which is basically saying that about 75% of people who get Lyme get it in their yard or their neighbor's yard. It's not out in the woods. It's not in all these high risk places. It's actually in your yard, because it likes the habitat of, we have the woods in the back, and then we have the lawn mowed perfectly. We have these beautiful gardens, and that's where all the chipmunks and the mice are living. And that's a perfect habitat for the ticks. That's their blood meal. So just think about it. It's not when you take a long hike in the woods, you got to be careful then, but it's most important to think about, what goes on like right at your own house, and you take the dogs out, or you run around before school in the morning and you haven't put anything on. So,
yeah. Well, I think that's what happened to me when I got Lyme. I'm sure I got it from my dog. I wouldn't spend a lot of time outdoors. I lived in Connecticut, an endemic area, but I never went hiking through the woods, and I would spend a little time out on my lawn. But, the dog was out every day doing her business, and we also had a dog that slept in the bed at night. So I'm quite sure I got exposed through that. And checking your pets is equally important as, checking yourselves, because I think they're a common reason a lot of people get exposed to Lyme.
Well, I'll tell you, it's like before and after we started treating our yards, and we use a local company that does both the bait boxes and some spraying of some relatively non-toxic but kind of toxic stuff. But it's like, there's nothing else we can do. We need to prevent it. And it's like, we would see our I had cats and dogs before I knew anything about Lyme disease, really. So and cats live forever, as anybody or most people with cats know. So they were bringing them in, and until we started to treat the yard, double check ourselves, our exposure was so, our risk was so high. So there's a whole bunch of questions popping up, and I'm trying to keep track of them. And I know that you've got some other ones, but we kind of talked a little bit about testing. Some people want to know about specifically what labs you're thinking about using. I feel like that's sort of a Pandora's box, but I think we could touch on that. And then I wanted to dovetail into treatment. And part of the treatment questions were treatment of an asymptomatic person with positive labs, treatment of a person maybe who's been sick for a couple of years, and what might we be doing in that sense.
Sure.
So we just to sort of kind of organize ourselves a little bit, because I want to make sure we get to as many questions as we can.
Yeah. Well, I think, when it comes to Lyme labs, again, it's sort of personal preference. I think we all have the ones that we favor for whatever reason.
Right.
Again, being someone who used to work in the field, I feel a little bit biased in this. I think my personal opinion for one of the best screening labs out there, I like Global Lyme Diagnostics. In full disclosure, I'm on their scientific advisory board, but I joined it for a reason, because the doctor that developed this test was a vaccinologist. He was actually trying to develop a vaccine for dogs for Lyme disease. And in his research, he discovered that there's a part of the Lyme organism that's unique to all the different strains of Lyme. The conventional test that's out there really only looks at one strain. That's Borrelia burgdorferi, which is the first species that we discovered in Lyme, Connecticut back in the 80s. And we've now learned that there's several other strains that can cause Lyme disease, but the testing still only reflects really the one test. So what I like about this lab is that if you've been exposed to other strains of Lyme that's not Borrelia burgdorferi, you have a greater chance of picking it up through Global Lyme Diagnostics than you would from potentially other labs. So they're kind of one of my go-to screening labs for Lyme patients. It's a cash test. Unfortunately, insurance doesn't currently reimburse for it, as far as I know. I think it's $295 for the test. But again, they do an IgG and IgM test that, again, might show if they had exposure to any of the Borrelia species. And then I like medical diagnostic labs in Hamilton, New Jersey for
where
Lyme.
I grew up, just so you know.
Hometown boy. But I like
Literally, that's my hometown.
That's funny. Yeah, I like MDL because, again, they do, I think, high quality testing. I also like the fact that they're the only lab that I know of that actually sends me a copy of the Western blot, so I can look at it myself and look at the different bands and antibodies. They do all the co-infection testing, and the biggest thing for me is that they bill insurance.
Right.
People are spending so much money out of pocket that this is at least something that insurance will reimburse. And for people who don't have insurance, they have a very inexpensive cash pricing system. So IGeneX is a great lab. I love them. I use them periodically. Again, they're just, it's cash pay outside of Medicare. Yeah. So for a lot of people, it's just a bit cost prohibitive. Armin Labs, I like early in Lyme because it's not testing antibodies, it's testing cytokines, which are a different part of your immune system. So you can get cytokine activity before you get an antibody response. So for people who might be in that first week or two of exposure, that might be a more appropriate lab to use. So those are some of my favorites. Which labs are you using, Tom?
Well, it's interesting that you bring up the early stuff too, because I use actually a fair amount of Imogen, and they're out of Massachusetts. They were recently bought by Quest, which is rad for people around me. Now, there's no lab that I think is perfect, right? But so I use a little bit of everybody, but I'm really against, and I like the way you're talking about, I pick and choose the ones I need. These are my workhorses, but I'm going to use the lab the person needs, because, I see people spending $2,000 and $3,000 at Igenics, and you know what? Somebody probably needs to do that, but I would be willing to bet that most of those times it would have been better off, that money would have been better spent somewhere else, like keeping it in your pocket, probably, So, the things that are important to me is I use Imogen for a couple of reasons. One is, now it goes through insurance. With Quest, for most of my people, they have great cash pay prices. They are fast as hell. I mean, I get results in 2 to 4 days.
Wow.
Right. And so I've had people come into my office and they look like crap. And I've treated them for Lyme in the past. They had recovered. They're doing well. They don't look well. They feel like they have the same thing again. And I said, all right, well, we'll start these treatments, and this person in particular preferred herbals. But then I said, we can do that, but you don't look the normal way you look. Let's get some testing. And I wanted quick stuff. I went to Imogen, and like 2 days later, they had DNA confirmation of Babesia, Anaplasma. They had Anaplasma antibodies. They had Borrelia miyamotoi, and they had Lyme disease. They had every single known pathogen that we can all agree gets transmitted by a freaking deer tick. They have, and the problem was he had no white cells. His red cells were really low, so he was anemic, and he had low platelets. So he was ready to bleed to death at any point, and I thought I might have to send him to the hospital for blood transfusion. But it was like in one day, it was like 1 hour I got the Babesia, then I got the Anaplasma, and a couple hours later I got the Borrelia miyamotoi. And it was like so quick. And for me, that's really helpful in the acute setting, because you save people's lives when they end up with 4 co-infections.
Yeah.
But chronically, I like them too, because they do an IgM, an IgA, and an IgG antibody screen and 2 IgG Western blots of different strains. And I can ask for an IgM if I'm nice. And they have a great Borrelia miyamotoi serology. So a lot of times what I'll do is I'll order the general panel from there, and then also the DNA if it's appropriate, but not all the time. And then I'll do like an IgM Western blot at Igenics, and I might use, typically for Bartonella Hensley, I'm using Galaxy, but I'm only using the antibodies. And what's interesting is I hear a lot of people talk about they're not getting positive Bartonellas. And I mean, when I have somebody that I order tests for Bartonella on, it's almost always positive. It's not, I don't know what the issues are there. And it's clinically, it makes sense. But the other comment too, and also before I forget, I do use a fair amount of Armin. I think they're very helpful. And a lot of times you'll see the cytokine response or the antibody response, but not both. So that's kind of, I find helpful. And some people where I'm like, hey, look, the antibodies all went away, but I'm not sure. I go back and I find out that actually, there was a problem there. And, they do have some cytokine reactivity. We treat that. And now I feel a little more comfortable. But the other comment too is I don't think it's important for everybody to be, every time you order a test on somebody, to be positive. Like I've heard people say, I don't like the way you test, because when I send labs to that lab, my people are always negative. I'm like, well, that's interesting, because I get a fair amount of positives there, and I also get a fair amount of negatives. So there's either the test wasn't all that good, or the other part was you were ordering a test on somebody and they didn't have what you thought they had. I mean, that's possible too.
Yeah, well, that's a great point. And I've seen this probably more with practitioners than patients. They keep ordering lab after lab after lab, waiting for their positive. And it's like, look, if you have someone who's symptomatic and they've got all the clinical signs, just treat them. I mean, you don't need the lab to prove it, but they keep wanting to have that concrete something to stand on, which we all like to have that evidence. But it ends up being very time consuming and costly to keep ordering, 2, 3, 4, 5 labs because you keep getting negatives. And remember too, if you're doing an antibody test, it's also depending on you having a healthy immune response. If you have any element of immune deficiency or immune dysfunction and you just don't readily make antibodies, it doesn't matter what lab you use, you're going to run into the same problem. So, don't beat a dead horse. If you've got the clinical symptoms and you feel confident someone's been exposed to Lyme or you've been exposed to Lyme and your test kind of keeps coming up negative. I think my best example, and I've shared this before, there was a doctor in Colorado, and his story is very public. I'm not sharing anything that's not known. He was an oncologist who was diagnosed with Lou Gehrig's disease, and he was in hospice and had about 6 months to live. And a friend said, "Hey, were you ever tested for Lyme?" And he said no. So he did. I think it was IGNX, and his test was completely negative, not one single antibody. And the guy, he says, "Well, I see, I don't have Lyme." Okay, well, long story short is he ended up going on IV antibiotics just to try because he had nothing to lose, and he completely recovered. Got out of hospice. He actually went back into full-time practice treating Lyme patients. I think he said it was his 6th test before he turned positive. He was so immune dysfunctional or deficient. It just took, once he started treating and kind of stirred up the pot, then he was able to elicit an antibody response. So when we're doing antibody testing, I mean, this is true for Lyme and any other microbe. If you get a negative, it doesn't always mean that you don't have it or haven't been exposed. Sometimes it just means your immune response isn't the way it's supposed to be.
Yeah, and I mean, I think it's also important too, is sometimes Lyme also knows how to hide, right? Like, and I hear, and so, and it evades your immune system. And so a lot of people are talking about, hey, Lyme disease is like there's this conspiracy theory, the government's done something to it, and that's all well and good. It might be possible that happened in the 60s, 70s, and 80s. But if you look at ticks from 13 million years ago, they've been found to have Lyme, like the Borrelia bacterium in them. And if you want to look at Rocky Mountain spotted fever, anaplasma, things that are in this rickettsial, family, they've been found in ticks that are over 100 million years old. So these things way predate human beings, and they've been around long enough that they know how to survive. So, and they're slow reproducing. They go in places where our immune system can't get to. They go to places our antimicrobials can't get to. So no kidding. I mean, so I've also heard of some practitioners that they'll just start treating you if it sounds clinically right, and they test you 6 weeks later. They won't even waste their time because of that. All the things you're highlighting.
Yeah, and I think that's not an unreasonable approach. Again, we all like to have something to stand on, to feel like we're not wasting your time and money on treatment that you don't need. But we also know that there's the capacity when you start stirring up the pot that you can get a greater immune response. So I think that's a reasonable approach. And if someone's proposed that to you, I would certainly follow through with that, because again, if you've had a negative test, once you start any kind of treatment, there's a good probability that at some point, you'll start to make antibodies, and that will be more evident that you actually are on the right track.
Yeah. So what do you do? So kind of the flip side of this is you have somebody who's got a whole bunch of positive bands everywhere, but they have no symptoms.
Yeah.
So asymptomatic patient with positive lab tests.
Right. So remember what the test is testing. The testing is testing for antibodies. So if you get bit by a tick that carries Lyme and it injects its saliva into your skin, into your tissue, your immune system reacts. If you are a healthy person with a healthy immune system, you can elicit this very efficient antibody response that basically takes care of the organism before it ever got to a point that it triggered symptoms. So in my world, if I see someone with positive antibodies and no symptoms, I personally don't treat. I think the likelihood of it, when people have Lyme, they're usually symptomatic. Is it possible that it's dormant, that it might come out later? It's possible, but I've also seen people that were feeling reasonably well. They start treatment and now they feel really horrible. So sometimes you can make things worse by stirring up the pot. And if you let the immune system do what it's made to do, it might get rid of it without having to intervene further. So for me, I think being a little least invasive at that point, if someone truly is asymptomatic. Of course, then again, I'm not testing healthy people. So I know other doctors, usually it's a family member that has Lyme. The whole family now wants to be tested to see if they have exposure, even though they don't have symptoms. So yeah, I think in that case, I've done it before. I don't really like to do it because I think it just breeds more unnecessary concern than you need to have. I'm like, if you're not having symptoms, we're not necessarily going to treat it anyway. I know, but we want to know, okay, well, it's your money, it's your choice, and I'm happy to go along with it. But I'm just a little amiss of treating people, certainly aggressively, if they're not experiencing symptoms.
Right. Yeah. And I think the same thing is like, I'm not going to go looking for it in a healthy person because they probably fought it off if they have it. Looks like we're having a little bit of a connection issue. I don't know. It looks like it's on my end over here. I don't know if your IG is still working there.
Yeah, you look like you're frozen there.
Yeah. Somebody said what happened. I don't know. I still have Wi-Fi, but who knows? So we'll just keep doing the best we can here. Yeah, I mean, again, like I always wonder, why did we order the test? And if a person is truly, if they're truly asymptomatic, why did we do it? Let's see here. Keeps pausing. Yeah, unfortunately, I see that. I don't know
If you
why.
want to stop the Instagram feed and restart it, we can do that.
Yeah, let's do that real quick here. And we can share. Let's try this again for everybody. Let's try. All right, we're live again. Let's try this and see if we can find Darin again. Now I've got a list of 1 million people. Here we go. Let's try this one again. Love technology. Maybe you're there.
Yeah, I just sent you a request there.
Yeah,
so
there we go.
Should pop up momentarily.
Thanks for waiting for Darin. Unable to join. Wow, this is fun. Oh, you know why? It looks like our thing dropped down. Bear with us just a second. It looks like my home's thing shot out, but it's back on. I just have to get it to reconnect here. Sorry about that, everybody.
So Tom, maybe while you're doing the technical stuff, I saw a couple of questions popped up here on our Facebook feed.
Cool, let's do it.
Sarah is asking, what are your thoughts on peptide therapy?
Haha. I was hoping you were going to take that one. Since I know that you actually went to the peptide course and I have not been yet.
Yeah, I think peptide therapy is very promising. It's still a relatively new aspect of medicine. I am just now starting to use it in my practice. So in full disclosure, I'm a newbie and I have not used very much of it. I think, I got dropped off again.
Yep, I just had to reboot. Sorry, I'm going to send you a thing right now.
Okay.
All right.
So, something like the BPC 157 has been used a lot in Lyme patients as really a way of kind of stimulating your immune system. There are other peptides that can be used as an anti-inflammatory. So I think they've got a lot of potential benefit. It's just you have to be very cautious with your dosing because typically these are things you're injecting every day. And for some people, who I've seen, even though I haven't been the prescriber, they've done it with other practitioners, and then they come back and tell me that they feel like they're overreacting or they're having almost like
a get Darin on.
So,
how's your Instagram there?
Let me try getting rid of Instagram, and I'll come back to it. Okay.
All right, sorry guys on the IG, but everybody on Facebook, thanks for dealing with us. We're trying to fix that up.
Okay, so I see live.
Darin joined. All right. Let's see if we can. You join. Let me see if it'll let you in for real. There we go. Gotta love it. I tell this story a lot. I have a friend who has a Tesla, and he can drive his car to himself outside of a restaurant by touching a button on his phone.
Okay.
And we can't keep this going. All right. There is Dr. Darin. Fantastic.
Okay, so to round out the peptide therapy, so yeah, I think it has a lot of benefit. Definitely, if you can get in the hands of a practitioner that's been doing it a while, I know there aren't a lot. I think it has a lot of potential upsides as a way of modulating the immune system. My view of Lyme disease overall is it's really a problem with chronic immune dysfunction, which is why people end up with chronic Lyme. And if you can help facilitate better immune function, this is a way to do it. So definitely, it's something that's, I said, I just went to a peptide seminar a couple weeks ago, and we are just now starting to implement it. So I'm looking forward to using more of it. Come back to me in 6 months, and we'll talk about this again, and I'll have more to report.
Yeah, and Darin told me I have to wait till like the fall till the next course. I know that Dr. Gabrielle Lyon was actually on with us a moment ago on IG. I think we we lost her, but I know she does a bunch of peptide therapies. I was almost going to plug her in, see if she could help us out there. But yeah, there's a lot of information out there on it. One of the other questions that came up in the comments that I figure we should get to at one point or another now seems like a really good time. What are your thoughts on immunizations? Because and I think this can dovetail into like your approach to treating Lyme, because I think it kind of goes hand in hand, I think, if I know you well enough.
Yeah. So you talk about just immunizations as a whole?
Right. And I mean, I think a lot of time the problem is like, you know, in California, it sounds like they got rid of the religious exemption. And in Connecticut, they don't really like that. And the medical exemption is basically like, you know, are you like, you know, going to die of, you know, imminently from a particular vaccination? And even if you've almost died from another one, doesn't matter. You still can get a different one. Yeah. And I know there's a lot of concern about that. So especially now with the, you know, with the measles outbreaks and stuff like that. So, and particularly the question I think had to do with stuff in terms of, you know, in a chronic Lyme patient, but in general also, I guess, because you work a lot with autism and prevention too.
Well, you know, my biggest concern is if you look at the way most vaccines work is that most of them contain a thing called an adjuvant, and it's something else that's added. In many cases, it's aluminum, and it's a way of helping stimulate immune response to whatever you're mixing with. So if you take actual measles and you inject pure measles into your body, your immune system will do absolutely nothing with it. It won't recognize it. That's not the normal path by which we get exposed to measles. It's respiratory. So if they just inject measles virus, your body won't do anything. It won't make any kind of antibody response. So they have to add an adjuvant, something to get your body to identify the measles to actually stimulate that immune response. Well, when you're using something like aluminum, which is a known neurotoxin, and if you've got someone with chronic Lyme that already has neurological impairment,
right,
you know, is there going to be any damaging effect from that adjuvant? You know, to be honest, no, we don't really study it that way because it's considered an inert ingredient. The vaccine manufacturers are not required to study it. We know from toxicology studies that aluminum is very toxic. So my biggest concern with a chronic Lyme patient is with any vaccine, you know, what's their body going to do with these adjuvants? Is it possible to stimulate some sort of hyperimmune response that might flare their symptoms? And indeed, I have seen that in clinical practice. So, you know, for someone who needs to be vaccinated for whatever purposes, they've got to be very cautious with it. They got to do it slowly. I would certainly never do more than one vaccine at a time.
right.
Again, I think depending on what you're vaccinating against, that's kind of a whole different story. But unless it's something that, you know, is really urgent or potentially life-threatening to that particular patient, if it's something that's a nuisance illness, then my preference is that they wait until they're in better state of health, if at all. But you know, if there's any evidence of autoimmunity, for me, that's usually something that I advocate for holding off because I don't know it's safe for the person at that point.
Right. So, and you know, and in my case, I would, you know, I agreed. Like, you know, it's like I think we do too much at once a lot of times, and we give it to people. You know, the whole point is to stimulate in a reaction so that your body can make antibodies to it. And if you're already sick to something else and you have fever and all this, why am I doing it? You know, or in the case of the chronic Lyme person with the suppressed immune system, are you really even gonna have a good reaction, a positive response, like a positive vaccine response to it? And we haven't really studied those things. It's just like when you go back to testing, no one studied Lyme and Babesia in the same sample.
Right.
We do a Lyme test, we do a Babesia test, we do a Bartonella test, but we don't know if they actually, it's not been validated if we put them all together. And it's the same thing. It's like we study vaccine response in healthy people. We don't go, oh, here's some really, you know, screwed up, you know, guy named Tom, and let's vaccinate the crap out of him. You know, it's like, oh, here's a perfectly healthy individual, and let's try this one thing, and it looks good. Now let's just slam it all together. And I don't know that that's been tested, you know.
Well,
you know,
and I think to your point too, you know, the concept of a vaccine is given to a healthy person to elicit this immune response. But, you know, they don't study these in unhealthy people. So what are the potential long-term implications in giving a vaccine to an unhealthy person? I mean, kind of along that lines, I see a lot of kids who go in for a sick visit with their pediatrician that get a vaccine. I mean, that's an actual medical contraindication. You don't vaccinate sick kids. Their immune system's not healthy enough to handle the load and probably won't produce the appropriate antibody response, but they do it anyway. So, you know, I think you have to take in consideration, you know, again, this is where I think, you know, medicine's gotten away from being very individualized. We're trying to put everybody in the same mold, but I think for a lot of Lyme patients, because they're, you know, we got a lot of evidence of immune dysfunction. I mean, there's plenty of studies now to show that. We've got a lot of research showing that causes an autoimmune problem. So with all these immune issues going on, again, I just think it's playing with fire a little bit.
Right. Yeah. When people are a bit healthier, I mean, certainly, you know, I've done when people need to get a vaccine or their parents believe in it, but they don't want those toxic adjuvants to have as much of an issue, you know, doing mitochondrial support and detoxification around the time of vaccination can be helpful. But again, it's like, it goes back to like Darin sits down and talks to people and he finds out what they're interested in, what they want to do, you know, and when you do that, man, it's like you can have a conversation and we're not so worried about losing that person and we're never going to give them a vaccine that potentially they might really need if that's the decision in that particular situation, because you're going to have good follow-up because you actually have a relationship. And it's not just like, you know, I went to the vet the other day. I love my vet, but she was just like, oh, your dog's overdue for rabies. And next thing I know, they're stabbing a rabies in them. I'm like, well, hold on here, you know, like this thing is such a thing called informed consent and not just like slam it in your face. You know? But,
I think it just needs to be very individualized. And again, if that's something that's on your agenda, you know, have a conversation with your healthcare provider, you know, talk through it about whether it's appropriate for you at that time. And maybe at a later date it is, but, you know, California, you know, we've got a problem here because they've gotten rid of, you know, pretty much all exemptions. We now have a bill that's trying to get rid of medical exemptions. They want to have a state appointed official determine whether your child qualifies for a medical exemption.
Well, we could fix that. Just make that you.
Yeah, I mean, I think it creates a lot of problems. And again, it really just takes the doctor-patient relationship out of our hands and puts it into the hands of a politician. So I don't have great solutions for it. I know that there are a lot of people in California, including myself, that are, you know, advocating for parent rights, for people's rights. I don't think any medical thing should be forced on anybody. We actually have an international treaty saying we won't do that, but you know, that's how politics go. So we'll keep fighting and we'll see where that lands. Tom, I was just seeing some other questions here we may want to get to. These are kind of interesting. Laura's asking, I just realized my question wasn't very direct. I think we missed her other question. What are your opinions on Lyme transference to infants?
Yeah, well, it happens, unfortunately. I mean, and so I wrote a note on Laura's question too, and we have a couple other great ones also. And, you know, for me, transmission of Lyme is most commonly, like probably way greater than 90% from a tick to a person, right? And I have to say, I'm kind of a little frustrated. Everybody's trying to tell you about the mosquito and the horsefly and the blood and the saliva and all this other stuff. And the science is weak. And, you know, we're taking away the focus on the tick bite and tick bite prevention being the #1 way to prevent Lyme. Now, with that said, now that I probably pissed off like 100,000 people, you know, I mean, we do know that spirochetes can be transmitted and cause Lyme from a mom to an unborn child. I mean, that's been published multiple times. I hear that some people don't believe it, and I'm pretty sure they came from the same institution that published the first case of it. So that is in the medical literature, and I think it's a real potential problem. Now, the information we have about transplacental transmission, or vertical, meaning from mom to the unborn baby, is, you know, that active Lyme disease untreated is really bad. And people with chronic Lyme, the information is really not as clear, but we do think that we want to do everything possible, which usually includes some form of treatment to prevent that. Now, breast milk transmission is something I get asked about all the time. And while we can find spirochetes in the breast milk, I'm unaware of any sort of studies that show, or even cases that show that it happens. A lot of people worry about it, but we haven't seen it happen. That doesn't mean it doesn't happen. And the same thing, like, you know, with sexual transmission, it seems like there's a small group of researchers who really are invested in making this a real thing. And I don't really care if it's real or not. I just want to know if it's real, right? I'm not invested in it being an STD. What I'm invested in is finding out, are there other ways people get Lyme and do it and get it? So the evidence of sexual transmission, like solid in the medical literature, is really not all that good. But there are a lot of cases, and I've had these patients. When I studied with Dr. Horowitz, people told me about it. Pretty much every Lyme doc I know talks about, somebody says, oh, I gave it to my partner, I gave it to so-and-so, sexually. And is it possible? We can find spirochetes on the female cervix and in semen, but that doesn't mean it is transmissible. But the possibility is certainly there. So it's something to think about. Over here, Mellow Candle said something about, I was pregnant when I contracted Lyme, but her daughter shows no symptoms. Should she be concerned? What's your take, Dr. Ingels?
Yeah, well, again, I see a lot of children in my practice, and mom had Lyme when she was pregnant. And again, if the daughter's not showing any symptoms, again, if you look at the research on vertical transmission, what they actually showed is not kids getting Lyme disease as we typically think of it. They actually had more birth defects.
Correct.
So, what I have seen in some of my kids that makes me suspicious are kids that have developmental delays, neurological impairment. They're not hitting their milestones on time. So I don't know how old your daughter is, but if she's been hitting all her milestones and she's got no other unexplained fevers, rashes, things that just don't seem normal, I probably wouldn't be terribly concerned.
Right. Yeah, and the vertical transmission piece, I mean, the science I know of is like stillborns, unfortunately, babies that didn't make it have Lyme spirochetes in them. That just means they had the Lyme spirochete. I mean, it's technically not Lyme disease, and they didn't confirm, hey, look, 2 and a head developmentally. That's awesome.
She's fine.
Fabulous. Don't test. Don't worry about it. And I've had some, kids who appear to have, from DNA evidence of tissue sampling, have Lyme and Babesia. And it was how we diagnosed mom with having Babesia, because all the other tests were negative. Treated mom, she got better. Baby, never got treated, and the baby's been spectacular. So, I mean, it's about the immune system and such. So it's important. And the transmission, again, the thing we know about is a tick bite. Let's prevent tick bites, and understand that the science is not all that good, and it's out, and people have to work harder to get the answers for some of these other things. But we don't know at this moment, what these other rates of transmission are. So, what else did we have in there? Oh, Nona mentioned what else can Lyme mimic? And because Lyme is called, syphilis.
How much time do we have?
Yeah, right. Lyme was syphilis was the great imitator. We figured out how to treat that. Now we have Lyme, which is another spirochetal illness called the next great imitator. And I'm going to throw it over to you, Darin, with one additional comment, which is, not only is Lyme the great imitator, sort of in my mind, but I also call it the great instigator, because I think it breaks a lot of stuff, and we go after Lyme when other stuff ends up being the primary cause after that gets screwed up. So what are your thoughts on those questions?
Well, certainly for me, anyone that's got any kind of chronic, arthritic and neurological combination of symptoms makes me very suspicious of Lyme or a co-infection. So, things like MS and rheumatoid arthritis and all those autoimmune diseases, in my practice, the overwhelming majority of people that have been diagnosed with MS, when I test them, do test positive for Lyme. So I do see that correlation. But I mean, I've seen, chronic fatigue, fibromyalgia are big, common sort of nondescript diagnoses that, yes, you might have that collection of symptoms, but it doesn't explain why. So, any of these chronic, mysterious, inflammatory conditions, if you've gone through a litany of tests and everything's like negative, 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 including all the autoimmune blood tests, then, Lyme and co-infections are pretty high on my list.
Right. And so Nona just put up another comment here too, to saying that I think I read it backwards, but but it says, what other diseases mimic Lyme? And I think that this goes back to something we talked about in the beginning, but what are your feelings on that?
Well, again, I think, in any of these autoimmune or chronic inflammatory problems, because we have so many diagnoses out there that are really just descriptions. If you look at the diagnostic criteria for fibromyalgia, you've got to have whatever 15 out of 19, trigger points when you go push on the muscles. You've got to have, for chronic fatigue, there's a set of criteria, but, none of it says why. Why does somebody get lupus? Why does somebody get rheumatoid arthritis? Why does someone get, MS? They can tell you the process going on in your body, but they can't tell you the why. And if you dig into the literature, I mean, we have a bunch of evidence, not just Lyme, but Epstein-Barr and Klebsiella and Mycoplasma and Candida can all trigger these inflammatory autoimmune problems. So, again, as we're trying to get to root cause, it may very well be that, we're really not just treating the infection, we're really treating this overarching autoimmune problem that encompasses a lot of different things. But, my practice has really evolved over time that, we just don't focus on the bug anymore. Now we treat the person, and we have to deal with all these immune things. And like you said just a few minutes ago, Lyme kind of creates this wave of destruction in its path. So now we have to clean up the mess of all that stuff that, Lyme has shifted.
Right. Well, and it goes back to that, like, when we were talking about how Lyme disease has great ability to hide and to go to play, to do things to your body that disrupt it. I mean, not only does it, cloak itself from the immune system, it clogs up detox pathways, it hides in places your immune system can't go, it goes to places antibiotics can't go. So, I mean, there's a lot of things going on. And, it's interesting. I appreciate, Cindy was sharing everything for the Pandas Pans group. And, I know we both see a lot of autoimmune encephalitis, particularly infection caused in children. And there was a question, earlier on about the use of LDN and stuff. Yep. And so I think that that's a good dovetail into some of that as well.
Yep. So I use a lot of LDN in my practice. To be honest, I'd say it's about a 50-50 response.
Yeah, same here.
People feel like that it helps their health in whatever way, whether it's controlling their pain, helping with their immune system, and the other 50% really report it doesn't help. I fortunately have not had really any negative reactions. People feel like they got worse. That's pretty uncommon. I've had just a handful of people that tell me they got weird, wonky, vivid dreams after starting low-dose naltrexone. But by and large, I find it's pretty well tolerated. It's very inexpensive. And I try it on most of my Lyme patients. We give it 2 or 3 months, see if there's any improvement. If not, we ditch it. But I think it's worth a shot.
Yeah, I agree totally. I do the same thing. I mean, it's kind of cool too, because it, like, for me, I always like getting as close to natural as possible and supporting your own function. And, it works by basically blocking opioid receptors, and then it unblocks. And for whatever reason, in that low, as in that low sort of blockade, and it just, then your body goes, oh, let's let off endorphins. And so we take it at bedtime to augment our natural endorphin release. So we're actually getting immune modulation and cytokine modulation, by just asking your body to do more of what it's supposed to be doing anyway. So, I mean, I find that that's like really good. And, somebody at the Thrill House mentioned LDN turned around their inflammation in a huge way. And, some strange dreams. And I think I have a lot of people who have strange dreams. There's no doubt about that in my group of people. But yeah, I mean, but it's, the one thing that's interesting is I've not, and thankfully my desk is wood so I can tap on it. I haven't seen anybody who's really had nightmares. It's mostly just like they get some movies, and, there's a couple people mentioning, hey, it didn't work for me, but, it's worth trying. And I agree, like what Darin is saying is it doesn't work for everybody. And typically what I find with LDN is, like Darin was saying, 2 to 3 months. And in our more chronic, more complicated people, sometimes they need it for 4 or 6 months. But one kind of clinical sort of pearl is I remember I've had some people where the thing that really made a huge difference for them was diet and LDN. And it totally turned around their autoimmunity, turned around their tick-borne illness. But the thing that came up that was nuts was they're like, I think it was just the diet. So they ditched the LDN and everything fell apart.
Yeah.
And then they went back on the LDN for like another year and stayed on the diet they'd only done it for like 6 months. So they go back on full bore, right diet, right LDN for a year. Then they were able to get rid of the LDN and they were able to manage it with diet. So, there's different ways to use it.
Yeah, well, I like the fact that it's really inexpensive. I mean, the pharmacy we use here in California, 3 months is $45. Whether you're on 1 milligram or 6 milligrams, there's no
Right,
difference
right.
in price. So, again, it's affordable for people. And again, you at least got a 50-50 shot of it doing something positive for you.
Right. Let's see. All kinds of stuff. Dysautonomia caused by Lyme, or is it a standalone, and may Lyme exacerbate it? Yes. The doctor said it might be separate. I don't know. Dysautonomia and Lyme.
I find them pretty common, mostly in my women Lyme patients for whatever reason. I see it far more in women than I do men. I don't know why. But I have seen people that after they get Lyme, again, I think it probably speaks to some level of neural inflammation and how it's affecting the autonomic nervous system. Beyond that, I don't really know what the mechanism is, but I have seen people who were really fine prior to Lyme, and afterwards they start getting, POTS, they start getting other types of dysautonomic, dysfunction. And yeah, I think it's Lyme related.
Yeah. Just a quick add-on for somebody. LDN is low dose naltrexone, and maybe somebody else can type that in for me because I don't want to mess with my IG screen since I screwed it up before. The other thing too about the tick-borne stuff is you got to remember that the POTS autonomic regulation has a lot of different mechanisms, and one of the pieces that people don't really understand is the influence of the vagus nerve on the heart. So there's a nerve that does a lot of us know about the sympathetic fight or flight mechanism, and then the parasympathetic is healing and rejuvenating and stuff like that, and digesting our food and sleeping. Well, the parasympathetic allows us to keep our heart rate at bring the level down. And it also allows us to digest our food and keep our gut working properly. And that comes out all in the back of the head here and the neck. So all of us with our head forward posture are screwing with our vagus. A lot of us get locked. There's a thing called polyvagal theory where they talk about different functional pieces of the vagus. And the part that goes to the heart is the part that usually gets screwed up when you have Lyme or other chronic illnesses. So we lose some of the regulatory ability from a functional perspective, over this. And so there's a lot of these self-help things. And for anybody who wants to stick around to the end, I'll be sharing some resources that you can pick up that'll help you do some of these exercises at home to work on that. And it really can help change your POTS-like response, But the other part is babesiosis is well known to cause dysautonomia and dysregulation of your brain's ability to modulate the automatic, systems in the body. And certainly Lyme and Bartonella have been found in brain tissue, and they can kind of do those same things. So, I think that's an important thing to consider, that I see a lot of dysautonomia. Now, the question, I think, as it was posed is great. Is it like, you had autonomic dysregulation and then you got Lyme and they just made, and Lyme just made it worse, or co-infection made it worse? Or was it like the Lyme and co-infection caused it, and if you treat the Lyme and co-infection, it goes away? Or did you have Lyme co-infection trigger something you already had, and now you get rid of Lyme and co-infection, but this is turned on and you have to do something else still? And I've seen all three of those scenarios play out.
Yes. Yeah, exactly. I think it can go any of those directions, as you mentioned. I've seen the same thing where there's evidence prior to Lyme that they had some element of autonomic dysfunction, although very mild. Maybe they're just a little, hypotensive. Their blood pressure always runs low. They get a little lightheaded when they stand up too quickly. And then, they get Lyme and it's like gas on the fire. And then I have other patients that said who are perfectly fine, and then after Lyme, they start kind of breaking down. So I'm sure it can go in both directions, and that's been my clinical observation as well.
Cool. So there's a question from Candace about what causes brain inflammation. And I think that this is kind of an important place where we could start talking and dovetail into a lot of the work that I know we both do and you've written about in your book. I think it's really important for us to take a few actually more than a lot of moments and talk about like what gets the brain going and what are the parts of the body that we can work on to help get inflammation in the brain down.
Yeah. Yeah. Well, I don't think, and again, when you look at the literature, it's probably not one mechanism. It's a combination of different things that are happening. We do know that there are very specific proteins in the brain that get targeted as part of the autoimmune response to Lyme. So as your immune system's trying to fight the Lyme organism, it accidentally starts cross-reacting with different proteins in our brain and our nerves. So that's probably some element of the neural inflammation. We also know that there's a secondary method through the gut, that the gut-brain connection is very intimate, that people that have chronic gastrointestinal problems can also be more prone to having brain inflammation. A lot of that's actually probably modulated through mast cells. There's a doctor, Theo Theourides. His website's mastcellmaster.com. He's an MD, PhD professor at Tufts University, and he's done a lot of research on mast cell activation in the brain specifically. And what he found in his research is that when people get reactive, they don't necessarily get hay fever, or what we kind of think of, systemic mast cell activation. It can be very localized to the brain, and therefore you can get mood changes, behavior changes. I think this kind of also speaks to why a lot of people get neuropsychiatric symptoms with Lyme. It's that chemical reaction in the brain, and it really has nothing to do with serotonin. It's probably more related to histamine and some of these other chemicals. So I think that combination of autoimmunity against brain tissue, activation of internal chemicals within the central nervous system that are creating inflammation, that combination just sort of leads to the different symptoms. And depending on what part of the brain gets affected, that's what people experience.
Right. And what's interesting to me too is, like, I remember a couple of years ago lecturing at iLabs, and I was talking in the fundamentals course, and I was going to do my brain detox lecture a couple of days later, and I'm like talking about Bartonella, and I realized that that some of the cells that function like the immune system in the brain, the microglia, Bartonella goes into your brain and can be found inside the cells that are supposed to kill it.
Yeah.
So both I've seen literature showing that Lyme and Bartonella can hide in the immune cells that are supposed to get it, and Bartonella specifically in brain cells, and then if you look at like pandas, and people are thinking about brain inflammation with pandas, and they're saying, so for anybody who's not familiar, it's like pediatric acute onset neuropsychiatric syndrome or disorder after streptococcal infection. Yeah. Which is why we call it pandas. And, any kind of infection-induced autoimmune encephalitis we might call as PANS, or and people just throw out pandas, even though that's specific for strep. But the bottom line is, in the strep-induced brain inflammation, people have studied in your nose that you get inflammation, or I should say, when you have strep there, you have your own Th17 cells, so your own immune cells, T helper cells, that go after strep, and that's fine once or twice. But if you get recurrent infection, you have in the nasal lymphatic tissue, you just have congregation of all these immune cells that are your own cells that are primed for strep, but then they can travel back up the nervous smell into the brain and break down the blood-brain barrier, cause cross-reactive antibodies, inflammation, but cause inflammation of these microglia I just mentioned. And these are this is all in the absence of any true infection. So right. This is your own immune cells just causing an autoimmune sort of process where your body's gone haywire, causing brain inflammation. And then the important part too is, one of the primary ways of detoxifying sort of the dirty water, if you will, from around the brain and getting all the junk out is through the nervous smell. The lymphatics that are around the nasal, the olfactory nerve, which is that nervous smell. And people estimate that's 15 to 30% of brain detox. But then I went back, and a lot of the cranial nerves, as they exit the skull, actually have this lymphatic fluid draining from the brain there. And so it's really important that that nasal passage works well, that we have a good posture with our neck. The other thing that's kind of scary that a lot of people like Darin and I are dealing with are mold toxicity issues. And we found things like, nasosinus biofilms. All right, well, the problem is, and even just make it even more simple, what about somebody with chronic sinusitis? I just told you, like, up to 30% of the detoxification of your brain is in your nose. So if you walk around all day like this, I mean, you're behind the eight ball, and you're building up these toxins, leading to inflammation in the brain as well.
Yeah, it's interesting. I had a chance to talk with Dr. Stephen Fry, and he runs his own lab called Fry Labs. And right. One of the things that's really interesting about what he's doing is he developed a special staining technique where they are looking at blood. And again, when I was in microbiologist, I was always trained that blood is sterile. Anything in the blood, if it's there, it's septicemia. These people need to be in a hospital, and they probably got one foot in the grave. And he's been showing in his research that the blood is not sterile at all, that there's actually a lot of microbes that do pass through without necessarily stimulating this big immune response. But one of the things that he's been finding in his Lyme patients specifically is a heavy biofilm in the blood itself, and he's finding this very unique kind of fungus. And so I just think it's really kind of interesting that if we talk about, you know, our brain and inflammation, I can imagine, well, if it's in the blood, you know, how much of this is accumulating in the small capillary beds, because this is where kind of the log jam of our bloodstream occurs. And, you know, does that, you know, sort of micro accumulate in these small blood vessels, plugging it up, creating more localized inflammation? We know when your capillary beds, you know, get inflamed, they start to leak. You know, take your hand and whack it against the doorknob and you'll see what happens. If that thing's happening internally, you know, that leakage, you know, creates its own set of local inflammation. And if that persists on and on and on, again, I can see that as another mechanism by which you would have this chronic, you know, inflammatory reaction with very little way to help, you know, sort of detoxify it. But as you mentioned about the sinuses, it just made me think of that little tidbit. And Dr. Fry's comment is that he's now been recommending that you go more aggressively after the biofilm and the fungus to sort of, again, potentially get to the root cause. And so far I have one patient I've started on this specific protocol, and he tried everything under the sun for Lyme and really didn't respond well. It was antibiotics and herbs and all the things we normally do. And he's actually been doing really, really well on this protocol. So kind of interesting. I'll keep you posted on it.
Yeah, you know, and I think I get these questions like a lot too about what about this thing and what about that thing, and there's so many sort of like aha moments for certain patients where one thing worked for them finally.
Yeah.
But part of it is, what is that path of years or months or years of treatment that led up to that happening? You know, just like if you spend, you know, most of your life keeping yourself super healthy and your gut's in check, maybe you're going to handle the treatments of Lyme better than maybe somebody else. So, and certainly there's a shout out to Terry Walls and the Walls protocol, which is sort of like a modified paleo keto type of protocol. And certainly Terry eats 9+ servings of fruits and vegetables a day, which is some ungodly amount, like 18 cups, which, you know, go Terry, and it works, you know. Yeah. And part of the place I wanted to go with this thing too, Darin, is like, I think it's important for us to talk about the gut and stuff, but Kim had and Melissa both had some interesting questions, I think, that kind of go along with this. And Kim asked, like, you know, so what comes first, chicken or the egg, you know, Lyme or pandas, or, you know, low immune system function? And then Melissa's talking about, can chronic sort of motor tics and stereotypic movements be a symptom of a child diagnosed with Lyme? And so if we're going to lump this into sort of infection-caused autoimmune encephalitis and just call it PANS, so I don't have to keep saying that, or pandas, whatever, or AE, you know, sort of what do you think comes first, the autoimmune encephalitis or from an infection, or low immune system function? And then what symptoms might you see associated with that?
Well, it's always the chicken. So, you know, it's interesting, again, having worked with a lot of kids specifically with autism, where we see a lot of PANS. I think, you know, again, I've seen kids that, as far as I can tell, prior to their exposure, had a healthy immune system. These were not kids who got frequent ear infections, sinus infections, bronchitis. So as far as we can tell, their immune system seemed to be functioning fine. I think it is an issue that the certain microbes have that capacity to trigger autoimmunity. And in my population, I find Lyme is a much bigger trigger of PANS than strep is.
Oh, yeah.
When I've treated the Lyme more specifically, I get better results often than when I treat PANS. But I've seen sometimes for some people it's mycoplasma, sometimes it's candida, sometimes it's clostridia. So again, you really have to do the investigative work to figure out what that trigger is for people. But Lyme is hands down the one that's more common, at least in my population.
Right. You know, and in my population, I'd say it's the same. And I think mycoplasma's got to be in there. Candida's got to be in there. Other things that are really interesting, I've seen kids with mycotoxin exposure who have really, really nasty autoimmune encephalitis, because again, it's a fungus. It's just like candida, you know, it can trigger it. And talk about stereotypical movements. I've had kids with vocal tics and motor tics and neck shaking tics. I saw somebody today. You know, there's people who will go to school in in a moldy school building and come home, and by Wednesday and Thursday, all they do after they get home from school is lay in their bed and just kind of do these almost choreographed movements where they're just writhing for hours until they pass out. And and so it can be really tough. The other thing though too is Bartonella henselae seems to trigger a lot of autoimmune encephalitis.
Yep.
And I would say that in a lot of cases, I would suggest that Bartonella may be one of the few things out there that can look like an autoimmune encephalitis and not actually be it. Meaning, like, I start a treatment for Bartonella and everything goes away in like 2 weeks. I mean, which, I'm not saying we're done in 2 weeks. I'm just saying like a lot of those symptoms just clear right up, and it's complicated. I mean, none of these things are really all that straightforward because we've got that immune system dysregulation going on. And so I think of it in 3 ways. One is, if we look at infection-induced autoimmune encephalitis, we have to treat the underlying cause. And usually, I borrowed that term from Charles Ray Jones, but I would call it toxin-induced autoimmune encephalitis. So we have the toxic exposure that we need to address. We have the autoimmunity that we need to calm down, and then we have the brain on fire, right? Because a lot of times what'll happen is somebody would get a PANDAS type of thing or PANS, and they're like, oh, and then their kid goes to school and they get exposed to a cold that's not strep or not Lyme, but they're like, oh my God, their PANDAS is worse. I'm like, well, but they come in saying it's like the strep or the Lyme that's worse. And I'm saying, well, no, the autoimmune encephalitis got worse because they had another inflammatory / toxic insult, but it's not always the same thing. And so the problem is, in my experience, once we trigger somebody, they get more easily triggered by more and more different insults, and that's where school is necessary. Socially, it's necessary to learn and grow, but it's also a petri dish, an incubator sometimes.
Yeah, I think with PANS, you just got to really do the detective work. And it's funny, I listened to Sue Suedo speak last year at a conference I was at, and she's the researcher at the NIH that really kind of coined PANS. And she basically sat down and told us all testing is worthless. So we all sit there in disbelief and kind of shook our heads and go, okay. Here's like, well, you just treat people. I'm like, great. Well, we like to know what we're treating. So in my world, I still test. I still think there's value for me because we do a specific kind of immunotherapy that is specific to the organism that we're treating. There is value of knowing whether it's Lyme or Bartonella or Babesia or whatever it is. I think, for a practitioner who really just use antibiotics and they don't necessarily know what they're treating, maybe it doesn't make a difference much, but I find it beneficial to try and hone in and figure out what organism's the trigger.
Yeah, I love to find the trigger too, Darin. I mean, I think it's one of these things where I'm looking at it, and when I do use antibiotics, if I know what I'm treating, I can make a really tight package of treatment. Like if you have Lyme, Babesia, and Bartonella and strep, man, I can nail that with like almost nothing. But if I don't know, I'm like, try this, try this, try this. I want to be as specific as possible. And I think that a lot of, I think there's this sense out there in the healthcare sort of provider community that we're like, people who treat Lyme with antibiotics are just throwing shit and seeing what sticks on the wall. And I'm like, no, I'm trying to narrow it down, whether it's meds, whether it's herbs, whatever. And we really need to, get that taken care of, as specific as we can be, because it makes a huge difference in, efficacy of treatment, duration of treatment, and then also just, not exposing people to more side effects than they potentially need. Yeah. So, dude, everybody, I got to say thanks. There are like a gazillion questions coming in. It's kind of tough to follow, to get to everybody, but we'll do our best. And I know that some of the testing questions we already hit on before.
Tom, I saw it was an older question, but I think it's really important. Pamela asks, if you don't know when you were bitten, but did take doxy, is that a cure? Still not well, but told will not know due to Lyme or some other illness.
Wow.
And I think this is a common problem. People who get exposed, and whether they know they have Lyme or suspected Lyme, they're told, well, take your 10 to 21 days of doxycycline, and it doesn't matter how you feel at the end of that, you're done.
Right. Well, I have some strong opinions on that, but having had Lyme and been told that, and then I got treated for 10 days, 4 of which I laid on the floor, alternating sweats and chills, and 8 years later found out that was my undiagnosed, untested, uncared about babesiosis. And I still had Lyme positive, very positive, like 8 years later, and took me almost 5 years to get well. I mean, that sucks. That's like 13 years, guys. And I mean, that's like most of my adult life until I started being a Lyme doctor. So, it's interesting. If you look at, I always go back, and that's great that I had an experience. It's great that, Darin has experience. It's great that all these other practitioners have clinical experience or personal experience. But let's go to the science whenever it's available, right? And so let's look at Monica Embers out of Tulane University, and she did some studies on monkeys, right? So she took rhesus macaque monkeys, infected them for 4 months. And one group of them, she treated for 1 month of doxycycline, 28 days. And their blood test, predominantly became negative. But then they sacrificed the animal and studied their tissue, and they found viable Lyme disease in 100% of them. So to say that a different way, that's a 0% cure rate after a month of antibiotics. Then they took another group of monkeys and they treated them with a month of IV ceftriaxone and then 2 months of oral doxycycline. And yes, we did cure a few, a whopping 27%. So 3 months of treatment, including a month of IV, cured 27%. And then when you look at another study, she infected them for, another 4 months. And then they treated them for 4 weeks of doxy, and they just followed antibodies and then DNA tests and xenodiagnosis over the course of this study for like 10 more months. And what's interesting is if I track these antibody levels, some go up, some go down, some go down, some go up. It's like all over the place. Some never become positive. And they're testing multiple different antibodies of Lyme on multiple different animals, and there's no consistent pattern. There's literally like no one knows. But what happens is in the end, they all have Lyme disease still. So 4 weeks cures 0, not like 1 or monkey 0, and it's been repeated. So, again, we don't know what happens from time 0 to time 4 months because they've infected the monkeys for 4 months before we treat them. But if you think about it, most people who come in with a rash and symptoms are 2 to 4 to 6 weeks out from their bite anyway.
Right.
The only science we have that really is hard science that's good, as we talked about earlier, is if you inject Lyme or Lyme anaplasma into a mouse, that mouse, if you give them a 19-day long-acting doxycycline injection, will 100% not get Lyme, but that's because they're doing it right away.
Right.
So we need more studies somewhere in the in-between, but if you've had it for 4 months, and for me, the other problem too, is that I got treated. I had a rash. It covered like a fifth of my body. I had all this pain. They found me staring at a wall, drooling on myself, and they said, "You got to go to the doctor." But I got treated for 10 days. So the problem is, what does too short a treatment do? I know I still had symptoms, and everybody said you had chronic fatigue and fibromyalgia and all this other crap. But what about our testing, right? I mean, we do know that in the people who did the double dose of doxy prophylaxis, we prevented some people from actually having a positive blood test, and they still had Lyme. So I don't know what 10 days does, because everybody's arguing so that they can have their paper published or whatever. And, but what we need to do is really focus on getting better studies, in, maybe the animal model and then in people of what is the right treatment. And, what's interesting is some of the studies that were done on post-Lyme syndrome that came out of Johns Hopkins, it was showing that chronic post-treatment Lyme disease syndrome is a real thing that people are not making up, right? And I think that's good to say that
Progress.
People are nuts. However, the reason that they said they found no evidence of viable infection, but they did like 2-tier testing and like DNA. Like it's like negative, man. Yeah. I mean, we already talked. The 2-tier test is a 50-50. So it's tough. So anyway, it's my soapbox, but I mean, I think it's a long-winded way of saying that, like, short courses of treatment, we don't know if they're really doing it, and they might be making our test not positive.
Yeah.
What else have
Quick,
we got in here that we need to answer, Darin?
Gabriella. Oh, Gabriella. Hi, Gabriella. If you're still on, you said Dr. McCandless said that kids with autism with leaky guts, yes, they all have leaky guts pretty much. They react badly to low dose naltrexone if they're not gluten casein free because of opioid issues. What are my thoughts? That's not been my experience. I mean, pretty much all the kids I see are on a gluten casein free diet anyway for various reasons. Again, even kids on the spectrum, although they're mostly on that diet, I've not seen really negative reactions to low dose naltrexone. I've actually been pretty happy with it and find it's tolerated pretty well. So that's
been my experience. And I have to tell you, in my practice, it's, I have a lot of kids with pandas who one of their main symptoms is food refusal and avoidance. So, I mean, I'm probably the only doctor who will ever admit openly that I condoned eating fast food in my office. But it was a person who hadn't eaten anything but Ensure and a piece of bread a day for 10 months. So I was pretty happy. And eventually, hopefully, we'll get them on a gluten-free diet or something like that. But I have a lot of people who stay on sort of standard diets. I try to clean them up, but a lot of them have casein and dairy and gluten in their diet. And I've seen LDN not be an issue. I mean, I've also seen kids with tick-borne illness as well as mycotoxin illness, and adults too, I should say, where their leaky gut is from their infection, not from something beforehand. And I've seen leaky gut and food allergies go away with antibiotic treatment. I'm not suggesting that you should go, everybody with food intolerance needs to get antibiotics. I'm just saying in the right person, we do know that Lyme, Babesia, Bartonella can be mycoplasma, can be biopsied out of the gut wall. Right. And so it is possible that infection is causing it. We know that mold mycotoxins, the toxins from mold, actually in really, really low levels can actually be bactericidal to the good bacteria in your gut. And so like you were talking, Darin, about doxy being bacteriostatic. I mean, mold toxins are stronger killing agents against your good bacteria than doxycycline is against Lyme. Where do we need to focus?
Yeah.
It's in our gut, right? Oh, Tammy was mentioning a guy by the name of Nori Inishi in Mount Morris, PA, at Blackwater Osteopathic Clinic. And I just got to give Nori a shout out because he's a good friend of mine. He came to our, first ever integrative Lyme ski retreat in Utah this year. We're going to be doing it again next year for, practitioners. And this is a great excuse for healthcare providers to come sort of have community and go out and do some extreme skiing and then come back in, have a hot tub, and then do some hyperbaric treatments and then dive into learning about Lyme and mold toxicity. So Nori's a good guy, and I love skiing with him. So Darin, we did have a question a long time ago, and I want to circle back to a couple because like I said earlier, these are phenomenal questions, but hyperbaric and Lyme, hyperbaric in general.
Yeah. So, I had a chance to study with Paul Harch, who I would argue is probably one of the most knowledgeable practitioners on hyperbarics. Dr. Harch is at Louisiana State University, and he's actually published a lot of research. He's worked with the military, so he's done a lot of government work and very high quality research. And what's really interesting is that at low pressure and hyperbarics, you get this really nice anti-inflammatory effect. So my feeling is for particularly the Lyme patients where their primary problem is neural inflammation, probably works better than people that suffer more from just arthritis or other types of Lyme symptoms. But for that neural inflammation, I've seen low pressure hyperbaric oxygen actually be very beneficial. So what's low pressure? If you guys have ever done hyperbaric, it can be anywhere from probably 1.2 up to 2.5 or 3 atmospheres. And what the research shows is 1.3 to 1.5 with an oxygen concentrator is actually very effective at reducing inflammation. So that's equivalent to diving down to I think about 8 feet in water. It's not that much. So you can do it with the hard chamber, you can do it with the soft chamber. A lot of people like to do the soft chamber just because it's easier, and if you want, you can spend the money and buy your own chamber and do it at home. It's actually very safe. You don't have the risk of the chamber exploding on you. When you're in a hard chamber, because they pump oxygen in it, you have to be careful about flame and igniting. But in a soft chamber, that doesn't really happen. So you can go in with your iPad, iPhone, and hang out for an hour while you get your treatment. So again, I've been advocating more and more after having studied with Dr. Harch. And for my patients who have access to it and can do it, most of them report that they feel beneficial. So out of all the oxidative therapies out there, I'm not as big of a fan of ozone therapy. I think it's horribly expensive. And the number of people I've seen who really benefit, it's less than 10%. So given the cost versus the benefit, I think you get a lot more bang for the buck for something like hyperbaric oxygen. So if it's accessible and available, I would definitely look into it.
Yeah, I mean, I agree. I mean, anybody who's in our Empowered by Lyme support group, I've done Facebook Lives from within inside there talking about it. I actually, had a couple of good days over the weekend climbing with the family at the rock gym, and I torched myself. And last night I was dying, so I hopped in the chamber, and it really worked. So, I mean, I really like it. It's interesting when you look at the work that's come out of Europe and Dr. Harch's work, and some of the stuff shows the changes in toxic, metabolites in the brain, and like in as little as 10 1-hour sessions at 1.3 atmospheres. So it's great for detox. And then, the other part is Dr. Harch's work is like, well, I think it all started is like, a lot of people are doing 2.3 or 3 atmospheres, and they needed to find out if hyperbaric worked. So they did sham, right? They need a sham to compare it to. So the sham was what we would call mild hyperbaric, which is 1.3 atmospheres or less. And so they're like, okay. And what they found was both worked. So the conclusion wasn't that they both worked. The conclusion was the higher pressure didn't work because it wasn't statistically different than the placebo.
Yeah.
But what happened was the placebo was good. Both of them were better than nothing. Yeah. And so Dr. Harch even published a lady who had 40 sessions of an hour-ish each at 1.15 atmospheres, which is like 2 pounds per square inch. It's almost nothing. You barely even start to notice that there's any pressure on you. And there were massive changes in her Alzheimer's. Both functionality was like a moderate improvement, but then 6 to 38% improvement in metabolism of different parts of her brain. Yeah. I have my thoughts on frequency, but somebody, it looks like Carolyn here is asking about frequency of hyperbaric, and I'm going to add in duration of it.
Depending on who you talk to, and I think depending on what you have access to, Dr. Harch in his clinic, I know when people come in for a lot of conditions, he actually has you do it twice a day. So you go in the morning and do a session for about an hour, and then you do another hour session. Sometimes it's up to an hour and a half. And I think he even reported in some cases even 2 hours. So he'll have
4 hours in between.
Right, with at least that break in between. And then you do that for, I think he does it for 2 weeks at that schedule. And then you start to taper off thereafter. So for people who have their own chamber and obviously can do it as often as they want, I mean, you could go in every day if you wanted to do it. You're not going to overdo it with hyperbaric. There's no really such thing as far as I'm aware of overdosing.
Right,
so if you've got the time and you can go hang out in the chamber for an hour or so, you will probably get the most benefit out of it. I don't think it's as beneficial when you just go once in a blue moon. You're probably not going to see any improvement from it. So unless you can commit to doing it on probably at least 5 days a week for a handful of weeks.
Right. I've seen, I've seen changes with 10 treatments, like in the literature. Most people are doing 40. With those twice a day gigs. And I know some people, like for me, I'll go in once in a while because I'm using it for like recovery from athletics, kind of like a lot of the NBA and the NFL players. A lot of people are using it just for recovery. But when you're in a chronic recovery state, you definitely typically, need to do it a bit longer. But it's pretty good. And the nice thing about the home chambers and the office chambers that most of us are using is, like you were saying, Darin, you can poke a hole in the thing. And I mean, you're not going to have, the worst case scenario is your eardrums pop. Outside of that, you're not going to get nitrogen, which is called the bends and all those kind of problems. So it's important stuff. I see that my buddy Tyler Lewis here, who I'm sure you know too, is popped on.
Hey, Tyler.
A good shout out to her. So there's a question from Juliana about, does everyone with Lyme and co-infections get reactivated Epstein-Barr?
Well, depending on if you read medical medium. Well, consider that 80% of the people out there, adults anyway, have exposure to Epstein-Barr. So Epstein-Barr is a normal virus that most people get exposed to. I think it's very hard sometimes to know about whether Epstein-Barr has really been reactivated or if it's something normal. One of the most common scenarios I see is someone comes in with their labs, their doctor drew every virus, bacteria under the sun. So they tested for Epstein-Barr, herpes 6, and CMV, and everything else. And they've got these sky-high IgG titers to everything. And they go, oh my gosh, I've got this horrible reactivation of all these viruses. Well, there's a concept in immunology called polyclonal activation. And basically what it is that when your immune system gets activated to one thing, it kind of gets activated to everything. So imagine just having this very broad stimulation of your immune system. But when you're measuring IgG antibodies, because your entire immune system's geared up, then all these IgG titers end up being high. So it doesn't necessarily mean that you're having activation of that particular virus. It could just very well be that you're having immune activation overall. So with Epstein-Barr specifically on blood test, if I see, early antigen or IgM positive, I think that's a better marker that there might actually be activation, and then we'll kind of treat it appropriately. But when you just see these high IgG titers by itself, I think it's a little bit harder to make that jump.
Yeah, absolutely right on. There were some questions that I wrote down from earlier on I wanted to circle back to because I think they're important, and it has to do with anxiety and depression and then certain treatments. And, things to think about is, and I'll be interested to hear what your experiences are, Darin, but like, if you have somebody with like pretty significant depression and pretty significant anxiety, that could be in relationship to if it's caused primarily by a tick-borne illness. Now, there are a lot of other causes. If you're chronically sick, you could certainly become depressed just about being chronically sick and stuff like that. But just like, kind of understanding that this isn't all depression and all anxiety, but anxiety and depression that are pretty moderate to severe could be related to babesiosis if it's kind of the new onset stuff. Lower, levels of anxiety and depression can be seen in Bartonella, but what we see more in Bartonella is like the rage OCD, the acute onset of tics, very much like the autoimmune encephalitis type things. And so I just think that that's important. And I mean, the other part is the immune dysregulation and the gut dysregulation and sort of the screwing up of the vagus nerve and the communication of the heart all lead into that too. But so what's your experience been in terms of anxiety and depression with Lyme and treatments? And specifically, there was a question about CBD in there as well.
Yeah. Well, again, I think it's about treating the whole person, because we know that depression and anxiety are characteristics of Lyme and a lot of these co-infections. Again, it's about the overall approach. I mean, I generally try to avoid medication if at all possible, because again, I don't think it's really addressing the underlying cause. But again, you got to treat everybody where there's at. And if I have someone who's suicidal and we need, medicine to stabilize them until we can get to the root, that's fine. Again, I think we have a lot of natural products that can help, particularly for anxiety or depression. We got things like 5-hydroxytryptophan or S-adenosyl methionine, which can help with depression. L-theanine, which comes from the green tea plants, really good for anxiety. We have a lot. Is there
any chance that those first two have acronyms that people might be more commonly familiar with?
Like 5-HTP?
Yes.
Or SAMe?
Yes.
Yeah, I think people might have heard of those.
Yeah. I love hanging out with like molecular biology geek people.
So again, there's a lot of natural products that can be used to help stave it off. I think, again, as you're working through, the whole person, you're talking about their diet, you're talking about improving their gut health, you're treating the active infection, you're dealing with all this other stuff. I find as we deal with all that, a lot of these symptoms do improve. But again, for someone, particularly if it's really severe, you kind of have to use what you have to use. You do use a lot of CBD oil in my practice. Again, I find it clinically effective in most of the patients I use it with. With CBD oil, it is very much a function of dose.
Oh my God, yeah.
I'm amazed at how high a dose some people need based on their size. So I tend to start small anyway, but if we find that there's not really a lot of clinical improvement, I really have no problem of increasing the dose. For most people, if they get too much CBD, and I am talking about just CBD. I mean, I am in California where medical marijuana is recreational, but I'm talking about using the pure CBD product that does not have THC in it, or at least less than 0.03%. And the CBD oil by itself, again, can be very effective at modulating anxiety, sleep problems. We know that CBD oil is anti-inflammatory. It tends to be expensive when you get it to the higher doses. Mellow Candle's asking, what CBD brands do you like? I've used mostly CV Sciences. The company's called Canavest. I like them only because their product is the basis of a lot of research. They actually provide the raw material for research done around the world, so I know the product works. But there's a lot of really good players out there. I just started with a new company, and I'm sorry, they're brand new, or I literally don't even know their name yet. They're based out of Ohio, but the rep who used to work for Canavest now works for this company, and their price point's a little bit better. So we're going to try them out and see how that goes.
Right on. Yeah. I mean, I've had some good success with Bluebird Botanicals. I mean, they've been around for a while. I mean, kind of basic stuff, but and Kim Marie made a comment that, pathogens deplete us of nutrients and that create, healthy neurotransmitters, as well as CBD could deplete things like potassium. But, I think the thing is, in these situations, everything we do has the potential to imbalance something else if we just do it in isolation, or we just say CBD is the treatment for anxiety and pain or something, and we just use large doses without figuring out really what needs to happen. And I think that I think I've said this is like the third or fourth time I said this. I want to talk about diet and modulation of the immune system, because there's questions about IVIG, and I think we've talked about using LDN maybe in place of IVIG. Certainly, I think there's a role for IVIG in certain patients. But, there's this point where we have to remember that you guys are all in charge of your own health. Like, Darin is responsible for himself. I'm responsible for myself, and providing the raw materials for our bodies to function as best as they can under the given circumstances. It's like, none of us walk out in the field and go, hey, I want to get bitten by a Lyme. But you can say, hey, or by a deer tick and get Lyme. But you can certainly say, I'm going to choose to eat a healthy diet today and every day from here forward, so that, whatever I have in my body, I'm going to make my body so healthy, it's going to be inhospitable for anything bad to live. So.
Preacher, brother.
Yeah. What are your thoughts on diet, though? Because I know you wrote like a whole book on it. So
actually, just one chapter, but yeah, diet's huge, and I think it's the one piece that gets overlooked a lot. Sometimes we focus so much on trying to get rid of the bug, we forget about this very foundational part of our health. We know that up to 80% of our immune function comes from the gut. So if the gut isn't functioning well, it's going to be very hard for your immune system to function well. And because of that relationship between your gut microbes, your immune system, a lot of neurotransmitters like serotonin actually get produced in the gut itself. So it does have an effect on the brain. So that trickle down effect of what happens when the gut's not functioning well is just enormous. And I've had some patients where, before we can even really get going on any active treatment, we start making these diet changes and we see this enormous improvement in the way they feel. So I wouldn't underestimate the importance of following a good diet. And again, I kind of talk in my book the difference between paleo and autoimmune and anti-candida diet. And again, my experience again as a Lyme patient and having used it with thousands of Lyme patients in my practice is what's called an alkaline diet. And very simply, it's just a diet that helps promote better alkalinity in your body. And if you look from a physiological standpoint, with the exception of your skin, your stomach, your bladder, and for women, the vaginal area, which is very acidic to protect against outside invaders, the rest of your body actually functions in an alkaline state. So the more we eat foods that kind of help promote that alkalinity, that means all the cell functions are working the way they're supposed to, the enzymes and all those processes. As the body becomes more acidic, in essence, it becomes more inflamed. So, this is a really, the one thing that you have 100% control over against what you put in your mouth, and you can choose to put things in that heal or hurt you. And I find, again, when people kind of get used to following an alkaline diet, clinically they feel better, and they find that they're not starving, they're not deprived. It's not a diet where we're going down to calorie restriction and you're hungry all the time. This is just really about making better food choices that work with your body instead of against it.
Well, I think the thing that's interesting too is because I when I was sick, everybody was just like, oh, you got fibromyalgia, whatever. And I'm like, no, there's something wrong with me. Don't give up on me. And I couldn't turn it. So the things I did was I learned that, you could change your diet. So I made a radical change in my diet, and it was far from even being like, a good diet compared to what I know now and what you're talking about. But the reality is that made a huge difference. And then I did yoga an hour and a half a day, 6 days a week for a year and a half, because I physically could do that. And I required that for the other healing. But it was like, I did what I could do to make a difference. And I was like 70% better. I mean, the other 30% sucked. It was really hard to get past that part, but I did every single thing I could do, and I think the other part that's really important to me is the more and more we look at this, there's such a role of the limbic system, our emotional system, and our memories. So how many people that you see complain of brain fog?
A lot,
right?
Most of them, yeah.
Right. And so here's the trick, guys. First thing you need to do is I need to go to bed soon because it's getting late, right? Because I need a good night's sleep, because my brain detoxifies primarily while I'm sleeping. So go when we're done, turn off your Wi-Fi, and every night turn off your Wi-Fi. Put it on like a timer and have it go off so it doesn't interfere with your sleep. Start going to sleep and work with your practitioners or to get a good night's sleep. That's going to help you detox your brain. And the other thing is eat really good food, because if you're not eating really good food, you're not detoxing your brain, you're causing inflammation. And if you want to have good memories, take care of your gut, because your gut feeds back into your brain directly through the vagus nerve. And if your gut is off, it will change not only your ability to create new memories, but even recall the memories you've already made. So if you want to fix your brain, brain fog, get some sleep and get some, some good food. The other part is a lot of what goes on in our gut is regulating, like, you were talking about, Darin, like serotonin and stuff. I mean, it's all being regulated in our gut, and this is how our emotions are. But the important part is going back to the POTS and all this other thing is our emotions will regulate our physiology, and our physiology will regulate our emotions. So do some of the things that you can do to allow yourself to be okay with having chronic Lyme disease and having been handed a shit hand of cards. A friend of ours by the name of Joan Rosenberg has this book, 90 Seconds to a Life You Love. It is by far like the best resource I've seen for quickly and easily allowing yourself just to recover a little bit of this energy that we waste, creating bad memories, fighting our emotions, and just being able to sit with them. So certainly that's been posted on our Facebook page. I'll stick it in the comments at some point. But, look at Darin's book, look at the different ways to modulate the immune system, look at your food, there was a question about Buhner herbs. I know you talk about those, Darin. And so, and then look at some of the work that we're doing with, the emotional side of things allows you to take your personal power back. It allows you to gain your energy back. And just by, there's research on just breathing a couple, 5-10 minutes a day. Well, when you breathe, you calm your central nervous system down. Those autonomics get parasympathetic, and then you get an immune boost. So if you want to boost your immune system, sleep more, eat better food, and then focus on your breathing for 5 to 10 minutes twice a day. I mean, and these are things that you really can do at home, and this can help you tonight. And the other part is this whole thing about drinking enough water. Unless there's a really rare medical condition that you have, you can handle a little more water, and having about 70 ounces of water a day is a good thing, because all the fluid around the brain, most of that's water. All the fluid in your blood, most of that's water. Most of your body should be water. So Yeah.
And by the way, this is a coffee cup, but I am drinking water. So.
Yeah, even though it's like 8:30, or what is it? No, yeah, 7:30, huh?
It's only 7:30 here. Yeah.
Oh, lucky dog, early in the evening. Yeah, no coffee for me. I'd be up all night. But it's interesting. It's like, when we think about our coffee, I mean, it blocks adenosine, and adenosine is supposed to rise throughout the day so that we can go to sleep. And so if it's too high, we take the coffee to knock it down, and we get some energy along with the caffeine and all this stuff. So, and then alcohol, a lot of people get tired with alcohol, right? But it's because it's it's a GABA agonist. So it's like we've got all this GABA going on, and so we fall asleep, and then we wake up in the middle of the night because we had alcohol, and it blocked our natural GABA rise. So it's all these things that we choose to do make a difference. And, you know, it's not to say you can't have a drink or have some coffee, because, you know, but it's interesting the choices that we can make and that we make at home, where we can, you know, gain some power over what we're doing and really take care of ourselves to really augment what we're doing with our docs in their office.
Yeah, well, I think you make a great point about the importance of self-care overall. You know, I think so many of us who've been through Lyme, and I certainly went through my phase of being horribly depressed and angry and just not myself. And I think we all suffer from a little bit of PTSD, having dealt with Lyme in our own way. So being able to realize that, you know, we need that element of self-care, and that means, you know, sleeping appropriately, moving our body to the best of our abilities. I mean, I can remember being so exhausted, literally I would plop in front of the couch in Connecticut and I would just try and stretch. That's really all I felt like I could do. And it didn't feel like anything. But over time, I mean, I started walking and walked outdoors, and, you know, eventually started studying martial arts. And like 8 years later, I got a black belt in karate. So it took me a long time to get there. It didn't happen overnight, but, you know, the value of, you know, just having that commitment to do something that helped myself. It's critical. And I think it's different for everybody. So, you know, what worked for me isn't for you. So find the thing that, you know, works for you. I think if it's, you know, meditation, if it's massage, if it's art, if it's music. Gosh, Tom and I were at a meeting a couple weeks ago, and we had a little jam session, and I found it actually extremely therapeutic. You know, we were doing it just for fun, but I love music, as does Tom, and he ripped on the guitar, and I played some drums and sang, and we had a great time. So again, find those things that you love. I think it's so easy when you're not feeling well, you lose those things in your life that bring you joy. And I think it's important to find the joy in life, because it's just so easy to miss. So, you know, find out what it is for you that brings you some joy and happiness, and that you can share with others. And it just makes a huge difference in the recovery process.
Yeah, I mean, I think it's so absolutely critical, and it is that joy, you know, and then we lose a lot of it, and there's so much of, I can't do it, you know, and I don't have the energy, or I'm afraid to do it. And some of it's true, but there's some part of it that you can do, and you don't want to lose that. Because what's interesting, when you look at the you know, what's called polyvagal theory, where we're looking at the how the vagus nerve that controls the parasympathetic and the healing goes to our heart and to our gut. The part that goes to our heart has a lot to do with joy and our social engagement. And one of the problems is, we talk about fight or flight as sympathetic, and the rest, rejuvenation and social joys and interacting with people, as parasympathetic. But there's another part. So when we think about sympathetic, the fight or flight is, I can run away, or I can stay and fight and make it. But what if you can't? What if you're stuck? Like if you're a little chipmunk in a cat's mouth, you have to play dead, and you get frozen and hopeless, and your immune system gets suppressed. You don't feel like you're ever going to get better. You get numb, and then you start to socially withdraw, you know. And so it may sound ridiculous that all of these, you know, doctors who are going out like and working all the time, or, you know, and trying to, you know, and we're in these groups to find a way to share with you how to get better and how to get our message to more people like you, so that they don't have to suffer with chronic Lyme disease, are taking time to be in a band. All right. I mean, I've never been in a band. I mean, maybe in 6th grade and 5th grade when I was playing viola, you know, and I jammed with people on the guitar in college, but it was basically like, but it's this joy of just going out and doing something that we're passionate about. And I think that that's so important to really do. And it'll help you get from the stuck, hopeless, frozen, numb place to back where you can do it and where you can heal, and you're boosting your immune system, you know. And it's tough, because I've been lecturing about this in one form or another for years, and I always feel like everybody wants the protocol. How do I get better? And those are important pieces, but the most important piece to me is, you have the greatest power out there. It's your health. And you actually can change a dramatic amount of it without even, you know, before you even get to one of our offices. And so, you know, it's just, I find that very invigorating. I know it's scary to a lot of people to think that how much responsibility you have for your own health, but it's an amazing gift. I mean, you can make small changes that make a big difference. So.
Yeah, well, I couldn't agree more. I think there's so much that we can do for ourselves outside of, what you and I are directing people to do. It just takes a little bit of discipline, and it gets hard. Again, when you're not feeling well, the effort to cook, prepare meals. Again, I remember too vividly what it was like, and it can be pretty miserable. But I think it's also important to reach out to people around you. Don't be shy. Ask for help when you need it. You just can't feel bad when you're working to feel well, to lean on other people to help you get through the process. And I was fortunate to have a good support of family and friends at the time. And as much as I kind of people would ask me, "Hey, Darin, how you feeling?" Nobody really wanted to know the truth, and I knew that. I feel like shit today.
Aren't you better yet, Darin? Aren't you better?
Yeah, but at least they were doing the best that they could to be supportive. And when I needed help with something, they were willing to jump in. So I feel very fortunate in that aspect, because I know not everybody who goes through Lyme has that experience. But I think as much as you can, reach out to other people within your comfort level, it's just good. There's strength in numbers. And remember too, there's a whole community of us Lyme people out there. And even if it's online and something like this, get involved, reach out, connect with one of us, even if through social media. We want to help people in every way we can. So don't be shy about reaching out and asking for help when you need it.
Yeah. And so one of the things it's kind of getting pretty late on the East Coast. I think even with the questions we haven't been able to get to, we could do this all night long. So I think we should probably have another one sometime soon. One of the things I wanted to throw up, I told everybody at the beginning, I really wanted to share a little something that I put together. So I'm going to throw that up for just a second. Maybe I'll try to see if I can get our names out of here so it doesn't hit us in the face. Yeah. Anybody who's interested, I just wanted to say thanks. We'll share some of Darin's resources in a second, but if you head over to originsofhealth.com/thank-you, the number 3 free gifts. I have a couple things, and one's a handout called Common Reasons Treatment Fails and How to Avoid Them. There's simple things that you can apply starting hopefully tomorrow if you're on the East Coast, maybe tonight if you're on the West Coast, because one of them is sleep. The second thing is a thing called my top 5 brain detox tips. So again, if you're on the East Coast, read that tomorrow because sleep is number 1. And then there's another thing called Relax and Reboot. And they're just some of the exercises that I use with my patients in the clinic, and I've personally used and rotate through on a regular basis that help me balance out my nervous system. So I want to balance the autonomic nervous system, bring that sympathetic fight or flight cortisol response down, naturally boost up my parasympathetics, and then get that immune boost. And they're super simple, 5-10 minutes a day, once or twice, and they're exercises that no matter how sick you are, you can do. And that's probably my favorite piece of resources. I've got some cool pictures of myself and my daughter in there. So anybody who's interested, please head over and grab that. The other thing is, I do know that, Darin, I mentioned in the comments to join your support group. But if you could tell people about the name of that and the name of your book and stuff, because I find that your book probably answers a whole bunch of the questions we didn't get to just yet.
Sure. Well, the name of my support group is, I guess I should, the book, so this is the book, The Lyme Solution. I know it looks backward on your screen, but that's it. And so the name of the support group is the Lyme Solution Protocols. And like Dr. Tom's Empowered Lyme group, it's same concept. We're just looking for ways to help support each other. And my group, and I know Tom's group is too, it's all about positive reinforcement, positive things. What are you doing for yourself that's working? What we're not interested in is, woe is me, Lyme sucks. We know Lyme sucks. It's hard enough as it is, but we want a place that people can come, get good and reliable information, get support, help answer the questions, and not have to scour the internet to try and figure out what's true, what's not true. So hopefully you'll join both of our groups, and we'll be happy to help you guys move forward.
Yeah, certainly. I mean, I think the whole purpose of the groups is to give you guys a place to be real, but then be held, at least in our group, to be held accountable for having that your mindset be on healing. It doesn't mean you don't have bad days. It's just that there are these days where we need to do it. And, the brain is amazing. When you look at what the brain can do, it's absolutely incredible. Even an infected brain with broken down blood-brain barrier, it is the world's greatest goal-achieving machine. So if you decide that you're going to have chronic Lyme forever, that's true. You will. But if you decide that, you're going to be healthy and this is what your life is going to look like, your brain is going to start to figure out ways to get there. That doesn't mean that you're going to get there in a day or 3 years or 12 years. It depends on your situation, and not everybody can heal all the way. But man, just to be able to have that hope and to start boosting the immune system and move in that direction. And on a day where you fall, have your friends there. I mean, I was recently at a conference, and I had a slip and fall. We were talking about a lot of emotional things and ways to share our stories better. And one of my friends, in fact, Joan, who wrote that book, I mean, I knew her. I didn't know much about the book. And then she started talking to me and just supported me in a way no one had ever supported me before. And I was like, that's what friends do for each other. And that's what, Darin and I are doing, and everybody else in our groups is trying to support you through those hard times, but holding you accountable to a higher standard. It's not going to be one of these bitch sessions. It's a place where you can go and actually get the love and the support that you need, but then also, start to move in that positive direction, and, we're going to support you on the bad days too. So I'm pretty excited. And Nicole, thanks for posting Joan's book. I'm actually, it's interesting. I talked to a couple people about this, and I talked to Joan about this, but since we're public and we're live, I'm actually reaching out to contact her publisher. And this is because I'm going to buy bulk. This is how important I think this book is, that as soon as I get that ironed out, I'm giving it to literally every single one of my patients as a gift. That's how important it is, from the health side, because I see everybody's going out and buying Darin's book, and which probably means I got to go buy that book and give it to him too, now that I open my mouth. But I mean, it to me, the part that's so hard for us to support is that emotional side. Darin and I are so good at what we do, but to be a therapist on top of it, in the office, we do our best and in the messages, but it's sometimes difficult to be able to spend all the time you really want with somebody, and to give you a resource that's so helpful is really critical.
Yeah. And Tom, I should mention, if you're out there and you really feel like you've had a hard time, finding that person to reach out to, whether it's, you don't really have a family member or friend you feel like you can kind of unload on. I actually work with a woman who she's had Lyme disease since she was, I think, 18 or 20 years old. She's now in her mid-30s. She actually went back to school to get a marriage and family therapy degree, and she pretty much exclusively works with Lyme patients, and she does do it virtually. So if you feel like that's a resource you want, I can actually go in after and post in the comments. But if you go to my website and go into under, I think it's wellness coaching, her information's there. She's in North Carolina. But I've actually referred several Lyme patients to her, and they've really enjoyed working with her. And I like the fact that she's very proactive. It's not just sit there for an hour and listen to you complain and go, that's nice. That sounds really horrible. She's actually going to give you homework and give you some things to work on. Or I just like the way she reframes your situation in a way that helps you move forward. So if that's something that's ever interesting, I'll go ahead and I'll post that link after we log off.
That'd be awesome. And I just posted links to Darin's book and to Joan's book over on Amazon. But again, it goes back to what we were saying earlier. It's not one size fits all. And I have other people, therapists local to me, who do really things that do exactly what you were just talking about, Darin. But it's about figuring out what works for you and realizing that, sometimes that doesn't work. It's amazing, the first 1 or 2 times. And it always amazes me how many different protocols are necessary till you find like the right one, but there's a foundational piece. And I think that's what I love about your book is it's like kind of like you get the foundational pieces of what's necessary, and then we can add all the extra stuff that is ultra individual and necessary. But we don't want to sort of miss out on the basic fundamentals. I mean, I feel like we go to some of these conferences that are talking super advanced. Yeah. And what you and I, and you and I are trying to get people to, go back to the fundamentals of how the body functions to uplift your health and uplift your spirits. and then add the more intermediate and advanced stuff as necessary. But often a lot of those things aren't even necessary.
Yeah.
If you hit the foundation.
Yeah, well, like I said, I think we've both had the experience of people going out and spending a lot of money on various therapies. Again, I think they all have their place. I know we talked about like 10-pass ozone. Out here in California, it's $1,200 to $1,500 per treatment, which for most people just becomes cost prohibitive. And again, my impression for most people who do it, they get temporary benefit at best and not long-term benefit. So,
Right.
Tom and I both have the advantage of working with a lot of Lyme patients who do a lot of different things. So I think we both have a pretty good sense about what is most likely to help you given your specific situation for the buck. And I know we're always very conscientious about your pocketbook and want you to spend your money wisely. So, I think a lot of these, fundamental things that we talked about tonight is really a great place to start. And again, a lot of it's inexpensive, I'll say relatively easy to do. And a lot of it, you do have control over how it kind of works out.
Right on. So, Darin, this is awesome, man. Thank you so much. We're just shy of 2.5 hours and it feels like we just started.
No, this was great, Tom. I mean, I've been wanting to do this with you for a long time, so I'm glad we finally connected. And I'm hoping we can get together again and do another one. I think it'd be really cool, since we didn't really get into a lot of it tonight, about maybe some of our Lyme treatments and maybe talk a bit more specifically about the kind of things we use, why we use them, and go into a little bit more depth, because I know that'll be another long conversation. So hopefully.
Oh my God, yeah. And it's like I've still got a couple things here that we didn't get to, and thank you everybody. I mean, it's like we've been doing this forever. We've got a bunch of people still on. Thanks for sharing with all your support groups and friends. Remind them that the videos will be remain on Facebook, so you'll be able to get to them. IG doesn't keep them up too long, but we've got the recording, and then I'll certainly be posting this up to YouTube as well. So again, so Darin, one last thing. Is it DarinIngelsND.com?
That's DarinIngelsND.com. Yep, that's my website.
All right, let me throw that up because I want to make sure that hits here.
That's me.
Yep. For a second, it didn't look right in the font. I was like, oh, it does not look right. So head over and check out Darin. He's got some really great information. And again, I hope that we're all able to do this together again. It's super fantastic. Anybody interested in seeing us, that's where we're at. But follow us on Facebook for more of this. Follow us on Instagram. Thank you, everybody, for joining us. Any questions that you have for a future one, post them for us. We'll try to keep a list. But yeah, maybe we should do this sooner than later, because I feel like if we ask for too many questions, we're gonna end up having like a video book, and then we're gonna do this like 100 times. So, which would be great. I mean, any way to share this.
All right, Tom and I will look at our schedules, and then we'll figure out when we can do this again soon.
All right, everybody. Thank you so much for sticking with us. Remind all your friends they can check it out too with the replay, and have a great evening. It's such a pleasure to chat.
All right. Thanks, guys.
Thanks, Darin.